Welcome to the South Carolina Legislative Black Caucus and Prisma Health Minority Health Summit, featuring SLCBC members, health organizations, professionals, and leaders from across the state, providing information and conversations focused on health issues impacting South Carolina's Black and minority communities. Sponsored in part by Healthy Blue and Pharma. Post, share, and tag someone you know that needs information, resources, and advice, because this is a conversation you won't want to miss. But first, please welcome SCLBC Chair, Representative Patricia M. Hankin.
Welcome to the 2022 South Carolina Legislative Black Caucus Minority Health Summit. My name is Representative Patricia Hannigan, and I represent South Carolina House District 54, which comprises Marlborough, Darlington, and Chesterfield counties. I am honored to serve as chair of this historic organization that has been dedicated to advocating and fighting for the needs of Black and minority communities since its beginning in 1973. The Legislative Black Caucus is proud to have professionals and experts bring you this important program that focuses on the most important things to each of us, our health. In addition, we thank our summit sponsors for supporting this event, and you will see their commitment to the health of South Carolinians throughout the next few hours. We have pulled together a great program with topics and panelists prepared to share some great information. I invite you to ask questions and take notes.
No one takes care of families like Prisma Health. As South Carolina's largest health system, we have nearly 600 primary care doctors across the Midlands and upstate, so you can choose the one who's right for you. With a more personalized approach, more locations, and more convenience, including 24/7 virtual urgent care and online or in-person visits with your primary care doctor, we're doing even more to help you be your healthiest you. Prisma Health, the primary care experts.
The South Carolina Legislative Black Caucus was founded in 1975 with the mission to improve the quality of life for Black and minority communities in South Carolina. Since its founding under the leadership of Judge Ernest Finney Jr., the caucus has been the catalyst behind significant legislative action and policy changes in South Carolina that brought efforts of justice and fairness for all South Carolinians. Caucus efforts have led to state statute requiring consideration of minority businesses in the process of awarding state contracts, the creation of the Governor's Office for Small and Minority Businesses, the South Carolina Commission of Minority Affairs, and the state's Human Affairs Commission. The caucus is currently comprised of 45 members, including 12 state senators and 33 members of the South Carolina House of Representatives. In January 2021, State Representative Patricia Hannigan assumed the role of chair of the caucus, marking the third woman to be elected to lead the historic organization. Chair Hannigan has announced an active and comprehensive plan for the caucus that centers on increasing overall exposure and opportunities for minority communities across South Carolina. The South Carolina Legislative Black Caucus remains committed to its founding motto, "Like limbs, we reach toward the sun, but feed from a common root." The caucus remains readily available to serve the citizens of South Carolina, continuously fighting for justice and fairness. For the 2022 South Carolina Legislative Black Caucus Minority Health Summit. Panel 1, Disproportionate Health Disparities in Minority Communities. Our panelists include Dr. Marvella Ford, Associate Director of Population Sciences and Cancer Disparities at the Medical University of South Carolina. Serving in that capacity, an overarching goal of Dr. Ford's current research is to identify and address the disparities in cancer diagnosis and treatment success due to race, geography, and other contextual and or socioeconomic factors. She is a leader on several projects examining behavioral and community engagement factors affecting resource utilization, access to care, and clinical trial recruitment and retention of members of underserved populations in the state. Dr. Edward Zimmer is the director of the South Carolina Department of Health and Environmental Control, where he assumed his duties on February 4th, 2021. Prior to being confirmed as the agency director, Dr. Zimmer served over 30 years on active duty in the United States Navy and maintains an active clinical practice as a forensic and general psychiatrist, and has been an expert witness in numerous court-martials worldwide. He also has presented and published in the fields of disaster and forensic psychiatry, and has given numerous presentations regarding post-traumatic stress and the impact of deployments on service members and their families. And Representative Kimberly Johnson. Elected in 2020, she serves South Carolina House District 64, which covers Clarendon and Sumter counties. She also serves on the Legislative Oversight Committee and the Medical, Military, Public, and Municipal Affairs Committees of the South Carolina House of Representatives. Representative Johnson also serves as the Director of Community Engagement with Hope Health. Please welcome our panelists for today's conversation about disproportionate health disparities in minority communities. Good morning to each of you joining us on social media and also on YouTube, and welcome once again to the 2022 Minority Health Summit from the South Carolina Legislative Black Caucus. You have met our esteemed group of panelists this morning, so let's get into the conversation. Dr. Ford and Dr. Zimmer, I want to start with you first. What are the major disparities that you see through South Carolina's minority communities? Dr. Ford?
Yes, thank you. That's a wonderful question. South Carolina has significant geographic disparities compared to other states in the U.S. And so if we look at states like New York or California, we see a lot of disparities that are centered in our state that aren't as evident in those states. And many of these disparities are linked to overweight, obesity. We see a lot of high rates of diabetes, high rates of cardiovascular or heart disease, and definitely the area that I focus on includes high rates of cancer incidence, the number of rate of new cancer cases diagnosed per year, and also high cancer mortality or high cancer death rates. In fact, in South Carolina, among people diagnosed with prostate cancer, the death rate is 2.5 times higher for Black men than for white men. And so those are significant disparities that are faced here in South Carolina. We're also known as the stroke belt. I mean, we have very high rates of stroke, and I'm sure that we will talk about a lot of the social determinants of health that contribute to these disparities here in our state. I did want to say that we've partnered with DHEC. Back in 2019, we produced a report called Cancer in Black Men in South Carolina. That report is free. It's available online. And again, it was produced in partnership with the South Carolina Cancer Alliance and DHEC. Thank you.
Well, I want to come back to that and talk a little bit more about that report, Dr. Ford, but I want to come to you, Dr. Zimmer. Diabetes, heart disease, cancer, we're the stroke belt here in South Carolina. Why South Carolina as opposed to some of the other states, as Dr. Ford mentioned?
Well, I think there's several reasons. And one, I would say that South Carolina is similar to other southern states. Many other southern states, unfortunately, have these same problems. And one additional I would add is we see a significantly higher rate of maternal and child adverse outcomes in African American women than we do in Caucasian women. And that's certainly a major concern for us as an agency, an area that we want to focus on as well. Just to give you an example, for infant mortality, the rate in the nation is 5.6 infants per 1,000 end up sadly dying. In South Carolina, that number is 6.5. But for South Carolina African American women, it's women who have infants, their infants die at 10.8 per 1,000, and that's a very high rate. And to me, that's just unacceptable. And we need to do much better about all of these disparities, to be sure. And one of the things at DHEC we have said now that we're coming out of the COVID-19 pandemic, and although that's still a focus for us, one of our primary areas of focus now is eliminating disparities across the state. And of course, disparities go certainly based on race, but there's also disparities based on gender, based on socioeconomic status, and based on disability. And we need to address all of those. I think to answer your question, why are our rates so high here? I think there's a number of reasons. I think access. Many of our minority groups have poor access to care. There's a number of reasons for that. Certainly, there was a history of segregation in South Carolina, perhaps more than in some of the northern states that were just cited, and I think that still has lasting effects. That helps determine, for example, where healthcare facilities were located, because many of them have been where they've been for a long time.
Right.
And so that's certainly, I think, access to care is a big piece. I think access to other resources, and we'll talk about some of the things that Dr. Ford mentioned in terms of social determinants of health. It's great that, even if you can get the medical care, if you can't get the things like fresh fruits and vegetables because nowhere in your town sells them, or if, you don't have the opportunity for exercise because there's nowhere safe for you to do that. Those kinds of things, even though they're not directly healthcare, make a big difference in people's health, and I think contribute significantly to the disparities that we see.
Yeah, Dr. Simmer, that's so fascinating that to think that things that happened 100 plus years ago are still affecting us now.
Yes.
It's really sad to think in 100 years of whatever didn't happen, we are not or have not addressed that yet. I want to get back into that, but Representative Johnson, I want to get you in here for just a second because Dr. Simmer mentioned that now that COVID is not over, but we're hopefully past the major portion. DHEC and some other health entities want to focus on some of those disparities. Now we know that there have been millions of dollars that have been allocated to South Carolina to hopefully deal with some of these disparities. Can you speak on those dollars and how those dollars may be allocated and hopefully help focus on some of the disparities that COVID uncovered?
Yes, absolutely. And good morning. That's a great question, Trey. I just want to say that, yes, millions of dollars have been allocated. Though, if you're boots on the ground in the district, like I have been, and in surrounding areas, a lot of our rural areas just did not get that funding. And so we've been very fortunate to be able to partner with groups like Prisma Health, like MUSC, like McLeod Clarendon, and we've been able to get mobile units, and we've been able to send additional funding to fund opportunities like community paramedics. And this is, yes, you may be in a community because you've gotten the funding, but you may not know that rural dirt road, or that family may not know you and trust that you're able to tell them about a pandemic that they just don't have enough information on. And so what we've been able to do is to kind of streamline this funding and make sure that it gets to those programs, and that the constituents, the community members recognize the people that are telling them the information. And then we've been able to extend that to our faith-based communities, so that we've had an opportunity to go into our local churches, and so that we can speak with pastors and just put people in the forefront that that the community members trust. And so when the funding comes, it's very important to put it in the right hands, and so that it gets exactly where it needs to be to have the most impact.
How do we make sure, Representative Johnson, that the funding that is getting, because originally you said, rural areas didn't get the funding. So now with this new wave of funding, how do we make sure, that it gets to where it needs to get to, the areas and the entities that are going to really focus on the communities that need it the most?
Absolutely. And myself, along with several of my colleagues, have just taken on the personal task of taking it a step further. I know Wendy Brawley is going to be on shortly, but we're just in our communities. We're at the community centers. We are making sure we're at events, city council, county council, any type public board meeting. And we're asking for about 2 to 3 minutes to just address the crowd. And so a lot of times at those meetings, we may be singing to the choir. Those people may know, but we're asking you to go out and make sure that your sororities and fraternities know. We're asking you to make sure your church members, the elderly, the disabled, we're making sure that you are the mouthpiece to get it to them, so that we can make sure we get that message out. And if dollars weren't allocated as we may have been told, then we're making sure that we find additional funding and grant opportunities so that that entity can request that funding.
The South Carolina Legislative Black Caucus presents the Minority Health Summit. I'm Trey Taylor. We're talking about disproportionate health disparities in minority communities. You just heard from State Representative Kimberly Johnson. She represents District 64, Clarendon and Sumter counties. Dr. Edward Simmer is the director of the South Carolina Department of Health and Environmental Control. And Dr. Marvella Ford is Associate Director of Population Sciences and Cancer Disparities at MUSC. I want to go back to you, Dr. Ford. Dr. Simmer mentioned some of the factors that contribute to these disparities. So, what can we do? What can we do to help Black and Brown people, minority communities, as Ms. Johnson says, get the funding and then get the information, the treatment they need, so that there are not disproportionate disparities?
Exactly. That's a really great point. It's what can we do? So just to highlight a little bit more about some of the vulnerable areas of South Carolina, if we look at some of the social determinants of health, like unemployment, lack of educational opportunities, lack of transportation, a lot of those factors in South Carolina are clustered in what we call the I-95 corridor of economic disadvantage. This is a corridor of the state that has traditionally been underserved in many ways. And we understand the history, that this was land where there used to be plantations, cotton and tobacco plantations. And now a lot of land is
I think we are losing Dr. Ford. Unfortunately, Dr. Ford, we are losing your audio. If hope maybe you can disconnect and come back on. If the producer can perhaps contact Dr. Ford to let her know we have lost or are losing her signal. Dr. Simmer, as the other medical professional on the panel, I'm going to give that to you, please.
Sure. So, obviously we realize that the corridor along I-95 is a very challenged area in terms of medical outcomes, even more so than other parts of South Carolina. I think there's several things we need to do about that. I agree that funding is a big piece of that. Some of the things that we do, certainly as a state agency, I think we have a role to play, but we can't do it ourselves. We look for private organizations to partner with. We are actively seeking partners and have partners in that area, especially to ensure that we can get services to people. They can get those through community groups and individuals that they trust. I think, like Representative Johnson said, working with faith-based groups has been very helpful for us in making these sorts of things happen. Almost every community has a faith-based group. People usually trust their faith leader, perhaps more than they would a state official, frankly, and that's a good thing. And so we want to work with those groups to improve the people's health, improve people's access to care, but also many of the social determinants of health. So things like we have a major initiative right now for community gardens, and we're working with a number of groups in smaller communities to raise their own vegetables and fruit when they can't buy it locally. So that's the sort of thing. We are working currently with a group. This turns out to be in Columbia, but actually there are areas of Columbia that are very underserved too. And one of the things we know is that there are areas in Columbia where the rate of amputations for patients with diabetes is much higher than the national average for no good reason other than, we think, lack of access to good care. So we now have partnered with a faith-based group in Columbia using a federal grant that we and they applied for together for $500,000, and that's going to let us do a lot of educational outreach to an underserved community there, and hopefully make more services available to them and decrease the amputation rate. And try to get those folks out there, even if they have diabetes. Let's help them live better with that diabetes, and let's also try to prevent those things. And I think that same sort of thing can work in the I-95 corridor.
Yeah, that's Dr. Edward Simmer with SCDHEC. Dr. Simmer, that sounds amazing because you're right. There are not only, in the rural communities in Columbia, there are places, as you mentioned, that are food deserts. So
Yes.
if, again, you mentioned having access to healthy food and fruits and vegetables. So I love that idea of doing the community garden. Let me stick with you, and let's talk a little bit about maybe some other initiatives. You mentioned the grant for the community garden. Can we talk about some additional solutions that that DHEC and other entities are working on?
Yes, certainly education is a big piece of this. And it's easy to try to do education by internet, and that's a good tool for a lot of people. But we also have to remember that a lot of people in South Carolina don't have broadband in their home. They don't have easy access to internet. So internet's good, but we have to have other outreach methods as well. I think what Representative Johnson said about going to meetings and talking is great. We try to use flyers, we use mailers, and we reach out through community groups and offer speakers to community groups and offer them information that they can provide to their members as well. And we found that's very helpful. The other thing that we have is, of course, we have health departments in every county. And those health departments both provide direct services, things like, screening for chronic diseases, sexual transmitted disease screening and treatment. They provide contraceptive services. So they do a number of things and provide a number of health services that the population needs and often can't get elsewhere. But they also have a major educational function, right? And certainly our environmental side is involved with this too, because obviously most of environmental protection is really keeping people healthy, not letting them be exposed to polluted water and air, not having them exposed to lead in the soil. And so we do a lot of work with local communities, both identifying those risks and then educating people how to mitigate them and how to avoid the problems that come with some of the things that come with pollution. So I think it's all those things combined. It's not one thing in general, but I think all of those things combined that we're doing, and again, in association with many, many external partners, is what's going to get us there.
Yeah, I love that you mentioned the health departments in each county. I want to come back to that in just a minute. But Kimberly Johnson, I want to get you back in here. What do you think? You're on the ground. You're in Clarendon and Sumter County. Some may say some of that area is rural. And so what does a solution look like for you and your community?
A solution to me looks like raising the public and the provider awareness. If I can share a story, there was an area that saw an influx in ER ambulance transportation to the ER. And the patients weren't waiting to be seen. And that was not because of the wait time in the ER. It was because there was a grocery store next door. And so they were using the ambulance to get to town, to get groceries, and then find a way back home. And I believe this area handled it very well when they said community paramedics is the key. And so they requested funding in the county budget, and we were able to do that. And I believe federally qualified healthcare centers like Hope Health, and this isn't a shameless plug. I heard the introduction. I'm no longer employed with Hope Health, but I mean it. They get it right more often than not. And this is a healthcare center in one of our most rural areas in towns and cities all over. And they see you and they give you treatment if you have insurance, if you have no insurance, if you have just a little bit of insurance. And I think they have an excellent community component where they go out and they host health fairs and then they tell the people about the care. And you would be surprised, maybe not, but during these events, they have found people that have gone to the ER, been given a prescription because they could not afford to fill it, and they don't have a primary health care doctor. It just went unnoticed under the radar until the blood pressure elevated again, until the blood sugar elevated again. And so we started putting boots on the ground again and actually having medical personnel at this health fair. And we started partnering with pharmacy groups that could cover the cost of the medicine so that the person didn't have to be ashamed to tell you that I can't afford it or I don't even know where to get this filled. And so I think, again, informing the agencies, making sure they're aware, but making sure community members are aware that you don't have to go 12 years without care. You don't have to wait until it's cancer. Like preventive care is so much better. And Dr. Simmer, you mentioned the amputations. You know, a lot of that's going on in dental offices, and versus a filling or a dental procedure, it's a tooth extraction. And it's very eye opening that that's happening in some areas, and in other areas you can get the filling or you can get um, some better care. So again, boots on the ground, we're aware of it, we're addressing it, and we just need to do more of it.
Yeah, that's why we've got representatives and people like you in the communities, advocating. That's State Representative Kimberly Johnson, District 64, Clarendon and Sumter counties. Dr. Edward Simmer is next to her. He is the director of the South Carolina Department of Health and Environmental Control. Dr. Marvella Ford joins us again. She's Associate Director of Population Sciences and Cancer Disparities at MUSC. There is severe weather throughout our state, so I'm sure that may have affected your internet connection, Dr. Ford. We're glad you were able to rejoin us. If you'd like to continue
Thank you so
comment.
much. So
Absolutely.
I'm not sure how much you heard. I was talking about the social determinants of health and the I-95 corridor of economic disadvantage. Did you hear that part?
Yes, we
And that
did.
we focused a lot of our activities. And then I was just walking us through what the MUSC Hollings Cancer Center is doing. We have our Healthy Me, Healthy SC. Did you hear about our HPV vaccination program?
Nope.
Okay, wonderful. So we have a new van, and we are thankful to our state legislators for allocating funding to Healthy Me, Healthy SC, to MUSC and Clemson. And so through that program, we were awarded funding to establish a brand new human papilloma virus vaccination van. Exciting that P virus is linked to
Oh, I think we've lost her again. It's always right at that same point. Dr. Ford has lost her connection once again. We will again try to get her back on. You are watching the South Carolina Legislative Black Caucus Minority Health Summit. I'm Trey Taylor, and Representative Kimberly Johnson and Dr. Edward Simmer joins us again. Dr. Marvella Ford with MUSC is having some connectivity issues, so we are going to have her rejoin us when that connectivity issue is taken care of. You mentioned, Ms. Johnson, Hope Health, and I want to bring you back into this conversation, Dr. Simmer, because how can places like Hope Health, which are in some of these small and rural communities, really kind of taking care of the disparities, if you will, can they work with the state agencies like our health departments to provide better resources for those communities that they're serving?
Absolutely. Yes, I'm sorry. Go ahead, Representative Johnson. I'm sorry.
I was going to say absolutely.
You both said the same thing at the same time.
And I've seen organizations like Hope Health in this most recent budget, and I was pleased to see, and I think that's already, the budget hadn't been passed, but I believe the allocations are public, what we hope to have voted on next month. But I've seen organizations like Hope Health increase in funding, and one particular line item was a budgeted item for Black men in general, but those that tend not to seek preventive care. You know, I have a headache, let me lie down, and then I'll get up and cut the grass, and blood pressure might be up, but I need to wash my truck, or I'm strong. And men don't tend to want to go to the doctor, but this plan that was proposed in this budget, it is going to fix that, and it's no mistake that it was placed in an area in these parts of towns that will be near barber shops, hair salons, where it's just so easy to go in because you're already on that side of town running errands and taking care of business anyway. And so I think the more we realize, and I think COVID was a bad thing. The pandemic was bad, and we're still in it. But I think we've been more reactive than proactive. And I think COVID made us stop and take a look at quality access to healthcare. And as Dr. Simmer mentioned, we've been talking about broadband for the longest. But when we had to educate our children virtually, we started having more people say we need broadband.
Yeah.
So I'm happy to see those things continue to be placed in the budget and continue to be utilized to benefit the communities.
Yeah. Dr. Simmer, you wanted to chime in?
There are clearly many ways we can partner. I'll give you one example that we're doing right now. A group called Care South, which provides a lot of primary care in the Dillon, South Carolina area in that I-95 corridor. We have partnered with them to open a joint clinic. They're in Dillon, a very medically underserved area, so that they can provide the primary care. People can come in and get the health department services all in one stop. I think that will expand the reach for both of our agencies, both our agency and that private group. And I think that's going to be a big plus. I think another way that we are trying to do more outreach and working with a number of private partners is mobile units. Let's bring the care to the people. That can be breast cancer screening, that can be dental services, that can be lung cancer screening, that can be, just basic primary care. But you can do a lot of things with a mobile unit and, park it in the parking lot of the dollar store or whatever. And we actually have a partnership with dollar stores to do that.
Awesome.
But, really bringing the care to where the people are so that they don't have a car, they don't have transportation, that's no longer a barrier.
Yeah. Dr. Ford, can you unmute yourself and we can finish talking about the HPV facility or the mobile unit?
Yes, I'm so sorry.
It's okay.
Thank you,
We're
and I
glad
do
you got you
apologize
now.
for internet connectivity today. Yes, so the HPV, we're so excited and delighted to have the funding from the state legislators. So we have vaccinated 144 young people for HPV and about 200 for Tdap. So that's very exciting. That's an ongoing program. We also have our South Carolina African American men prostate cancer education and navigation to screening program that's funded by TD Bank. And we talked earlier that the prostate cancer mortality rates are 2.5 times higher for Black men than for white men. And so this program is allowing us to provide a 1-hour prostate cancer educational training session with Black men. It's very interactive. And then we're navigating them to screening. We've enrolled 98 Black men since last September. 88% of them were behind in their prostate cancer screening. So now we're navigating them to screening over the 3-month follow-up period. This program will continue for the next 2 years, and we're happy to provide it to any group across the state. We're meeting this afternoon with the Urban League presidents in many areas of the state. The MUSC Hollings Cancer Center also has our breast and cervical cancer mobile health unit, which again is in partnership with DHEC, which is our administrative body that provides all of our licensures. So we're very thankful for this partnership with DHEC. And as Dr. Simmer mentioned, quite often our mobile health unit is parked in the dollar stores because most rural areas have dollar stores, and those are the meeting places, the gathering places. That's where people go to find out what's happening in the community. And so that has been a really great partnership along with our federally qualified health centers in the state. We also have a vibrant lung cancer screening program at the MUSC Hollings Cancer Center with our rural hospital networks in Chester, Marion, and Lancaster. We're rolling out lung cancer screening across the state. The MUSC Hollings Cancer Center is also partnered with the VA. The VA has a tremendous lung cancer screening program and has screened more than 6,400 people in 4 counties in South Carolina. And many people may not know that South Carolina is slated to be the state in the U.S. with the second highest number of veterans, the second highest veteran population in the country. And I think that's supposed to happen in the next 5 years. So it's really good to already have these the infrastructure in place to meet the needs of the growing veteran population. One of our signature programs is our Moving Up Train the Trainer cancer education program that we established back in 2007 in partnership with the South Carolina Cancer Alliance, and then they have allowed the MUSC Hollings Cancer Center to carry it forward. That is a program where we really build on the human capital, the social capital in our state. So we go out to communities all across the state, and we give a training program. We leave everything that we have in the community. So every participant gets a huge binder, bless you.
Thank
We
you.
give them memory sticks, and we script all of the talks. So we ask them to take the program to other people in their communities. So 904 people have participated in those training programs, and they've taken the program out to more than 5,000 other people in their communities so that they can take the word out about cancer screening, early detection. And one of the statements that we repeat throughout the training session is early detection saves lives. And we
Yeah.
repeat that throughout because we know that a lot of the health disparities that we see, as Dr. Simmer and Ms. Johnson have said, a lot of these disparities are due to lack of access to care and late stage of diagnosis. So yes, the phrase early detection saves lives applies to many cancer types, but it also applies to diabetes, hypertension, a lot of other health conditions. If we can get in and intervene early, we can improve the outcomes. And I loved Ms. Johnson's focus on dental care because there's such a strong link between
Yeah.
access to high quality dental care and heart disease and diabetes outcomes.
Yeah, thank you. That's Dr. Marvella Ford. Those are some amazing initiatives and efforts that you guys at MUSC are doing to mitigate these challenges. And Dr. Simmer and also you, Ms. Johnson, talked about some great things. I know, Dr. Ford, you mentioned your meeting with the Urban League presidents, and both you and Dr. Simmer mentioned going to the dollar stores. I mean, that's amazing. But what are some other ways you are informing the communities about the various resources that are available? I mean, it's great that they're available. People have to know about it.
That's exactly right. And that's one reason we so appreciate you and just being here with you today to raise awareness and let people know of all the great services and programs that we have. I can speak for the MUSC Hollings Cancer Center. These are open to people across the state. So this is our mission, is to serve all the people. And I know that Dr. Simmer and Ms. Johnson have the same mission. That's why we're here. And we we use social media. For our HPV program, we're working school by school, school district by school district. I will give you one amazing example with our HPV, human papillomavirus vaccination program. We met with the Cherokee County School District. We met with the school nurse and one of the science teachers, and they said, would you be willing to do a virtual town hall before you come up with your van to administer the HPV vaccine? And we said, that's a great idea. We go into community saying, we don't know everything, we need to learn from you. The answers often lie within the community. We just need to listen. So we met, we had several meetings to plan the virtual town hall meeting. The school district made the agenda and we just kind of filled in. So the first speaker was a science teacher in the Cherokee County School District who's been diagnosed with a high risk HPV type. She talked about her experiences being diagnosed and how she wished there had been a vaccine available for her that would have prevented her from getting diagnosed. And she talked about a lot of the invasive procedures that she's had to undergo as a result of being diagnosed. The second speaker brought down the virtual house. It was her 14-year-old son, Cody,
Mhm.
who talked about his decision-making process that led him to get vaccinated. And he said he did not want to be the cause of giving a virus to someone else and seeing them go through what his mom has gone through.
Wow. Wow.
Powerful. And this young man on his own also talked about how he read the Immortal Life of Henrietta Lacks just on his own, not as a school assignment. So he talked about that as well. Then we had our experts speak, Dr. Jimmy Roberts, pediatrician from MUSC, Dr. Jerlinda Ross, gynecologic oncologist, and their presentations were very community friendly, very understandable. We also had a nurse from the local community speak, and partners from University of South Carolina and Duke were involved as well. We recorded that. It was published on Facebook, YouTube. I'm out of my depth here, but different social media platforms. We had that event on February 21st. It was a 1-hour session, 30 minutes of talking and 30 minutes of questions and answers from the parents. We had that on February 21st. By February 25th, 800 people
Oh,
had
wow.
viewed that 1 hour program. And when we went to the school district the next week, we vaccinated 57 young people in that district. And we keep going back because the districts are large, but that's how we're working to get the word out. And now as we work with other school districts across the state, because our HPV vaccine is booked through August now, we are using that same, we have received permission from Cherokee County School District to use that video. All the other schools are using it too, and we're creating these HPV town hall events using that video, but with live Q&A afterwards. That's just one example of how we're getting the word out.
Awesome, awesome. That's Dr. Marvella Ford, Associate Director of Population Sciences and Cancer Disparities at the Medical University of South Carolina. Also, Dr. Edward Simmer joins us. He's Director of the South Carolina Department of Health and Environmental Control, DHEC, and State Representative Kimberly Johnson, District 64, Clarendon and Sumter Counties. I'm Trey Taylor, and you are watching the 2022 South Carolina Legislative Black Caucus Minority Health Summit. We've got about 10 minutes. I do want to ask you, Dr. Simmer, before each of you give your final statements, to kind of piggyback on what Dr. Ford mentioned about how you communicate what you're doing to the community. And I want you to specifically talk a little bit about really touch this early detection. We all talked about Dr. Miss Johnson, of course, Dr. Ford, and you too talked about early detection. Are we, using social media, and are we going into the schools, as Dr. Ford said, and really helping to prevent what may happen when you're 30, 40, 50, to educate when you are in first, when you're in middle and high school?
Yes, absolutely. Yes, we are. And I think you have to.
Yeah.
I think two things that really stand out for, in schools, there's many, but I think one is, if you want to prevent obesity, you need to prevent it in children. So clearly, training children how to eat right, and of course their parents too. But we do a lot of work within the schools and certainly with community groups on proper eating, what to eat. Again, making those fresh fruits and vegetables available. But so I think obesity prevention is a big piece of this. The other thing that we're very focused on in schools is tobacco prevention. Most people who start smoking or use other forms of tobacco start before they're 18. And we know that, the lifelong, health problems for people who use tobacco. So those are two areas where I think we can make a big difference. I think that they are helping, and we need to do more. But so those are certainly two areas in our schools. And again, we also do outreach to parents, of course. And we look at other places that children are, for example, libraries. And community groups, boys and girls clubs. So, we try to reach out to all these various different groups, space groups too, because that's another place where there are a lot of children and parents. And we really try to focus on those education parts. And one piece I'll focus on, which is not just children, but, early on in the pandemic, we had a serious problem in South Carolina that the vaccination rates against COVID were much lower in African Americans and Hispanics than in Caucasians. And that was a challenge for us. And sure, we have billboards, all over the place about getting vaccinated and information on social media and internet ads and such. But it just wasn't moving the needle enough. And so what we did was we've created, and now we're going to use this for many other things as well. We really created a group to work with faith-based groups, with community groups. We partnered with the NAACP, with Boys and Girls Clubs, with the AME Church. And gave them information that they could then give to the members of their group. So the pastor could get up at the end of the service and talk about the COVID vaccine. And then we'd have some folks ready to give the vaccine, in the fellowship hall or wherever. So that was very easy to do. And if the pastor had the right information, which we gave them, we found that worked very well, to the point that today, if you look at the vaccination rates, African Americans and Caucasians are about equal, and Hispanics are actually more vaccinated than any other group in the state. So clearly, when you partner with trusted people in the community, give them accurate information and give them resources, we can make a change here, and we can overcome these disparities.
Love, love, love that. I mean, you've got to bring people to the table that know the specific intricacies of a community, because each community, each rural community, each gender community, each racial community has a specific way they communicate. And I always say, when in Rome, you got to, do what
Yes.
Romans do. And if it's a fish fry, if it's church, if it's whatever it is, we've got to, if we really want to make a difference, if we really want to move the needle, we've got to bring people to the table that know the complexities of the certain community. We've been talking about disproportionate health disparities in minority communities. I'd like for each of you to give a closing statement of your choice, but let's talk a little bit about what we can do as a community to help each of your entities, the government, DHEC, doctors, MUSC. What can we do as a community to help you all help us? Mrs. Johnson, we'll start with you. You're on mute.
Okay. Can you hear me?
Yes, we can.
Okay.
Thank you.
And my closing statements could simply be ditto to what you've just said. That's exactly what we are trying to do. We recently had a census, and the census tells us in most of our districts we lost population. And I may be in the minority, but I don't think we did. I think there were a lot of census workers that knocked on doors in subsidized living areas, and people weren't trusting the government. So I'm not going to be a mom with my child and maybe my child's father and my mother living with me and let you count all of those people, because I don't trust that I won't lose my housing.
Right.
And I believe we have more people. I know I mentioned Hope Health, Tandem Health in Sumter. They experience the same things. When you send your community workers out, you have the Hispanic population that may not trust coming to your event because they don't know if they'll be picked up, detained, deemed illegal. And
Right.
so that trust factor is so important. And you're right, Trey. If it takes a fish fry, if it takes offering incentives, people say, why do I have to give you something to do what you should do? Well, we don't have the trust in government that we once had as it relates to the pandemic, as it relates to illegal immigration or whatever you may be looking at. But when you get those boots on the ground in the communities that we've already alluded to, those type people that they can trust, we're going to be able to send a message that people can buy into. And we simply say, let's eat better, let's be more proactive. But if you have people often say that health disparities are self-perpetuating. If you have a parent who is too sick to work, they may be working without paid time off, and they may not have the best job, and they may not qualify for insurance. And so then 3, 5 years go by and they haven't seen a doctor because they can't afford to see a doctor. And so we have to make sure we have things in place where when we identify these disparities, we come not also with a problem, but a solution. And so I think we're doing a better job of that. I think we can continue to do better jobs in those areas. And I think things like what we've done today is a part of that. So thank you so much to the Black Caucus, to Prisma, MUSC, Dr. Simmer. You have always been very responsive. We call and he's there. And so Trey, great meeting you today. I'm happy to be a part of this panel. I've learned some things myself, and I hope those we've asked to tune in have done the same. Thank you.
Awesome. Thank you, State Representative Kimberly Johnson. Dr. Ford, your closing statements, please.
Yes, thank you. I think it's all about partnerships and relationships. And so, for instance, for our HPV vaccination program at the MUSC Hollings Cancer Center, we've worked a lot with Ms. Beth Poorer at DHEC, who linked us with all of the school nurses across the state. So I think one of the strengths of South Carolina is our ability to form partnerships and work together. MUSC, we again worked with Prisma Health on their annual community health programs. We work with the AME Church. So Bishop Green actually wrote the MUSC Hollings Cancer Center into the health ministry plan of the 7th Episcopal District of the AME Church. So We also work a lot with the AME churches. We work with Baptist churches, Methodist churches, and I think the idea is that we're all in this together. We are all residents of South Carolina. We live here, we worship here, we have family and friends here. This is our home, and so working together, we're all in this together, joining forces to address these health disparities and to come up with solutions. And the solutions truly come from the community and from different agencies and groups. And when we all come together, then we have great solutions that not only work, but that are sustainable.
All right, Dr. Ford and Dr. Simmer, your closing statements, please.
Well, thank you, Trey, and certainly thank you for moderating. Appreciate Dr. Ford and Representative Johnson. I agree with everything they said in their closing statement, certainly. And thank you to the Black Legislative Caucus for the opportunity to have this sort of session, which I think is very valuable. I think my closing statement is basically that disparities are the number one public health crisis we face in South Carolina. If we can eliminate disparities and bring everyone up so they have the opportunity for the very best health possible, we will solve many problems in South Carolina. It won't be easy. It's going to take a lot of work. And certainly DHAC is not going to do it alone. I completely agree. We need partners everywhere, from an amazing research institution like MUSC, but to our local churches, community groups, and individuals. Working together, we can overcome disparities. I think we've shown that. So I'm very confident that this is a problem that we can conquer, and we can make the health of every person in South Carolina better. And I think the key point here is that, I love to tell my staff, think without the box. People talk about thinking outside the box. I like to think without the box. Let's come up with new ideas. If someone has a great idea out there, or there's a community group that says, hey, we think we can help with this, reach out, let us know that. We want to partner with you. Together, we will overcome this problem, and we will make everyone in South Carolina healthier and have a better quality of life.
Awesome. Dr. Edward Simmer, Director of the South Carolina Department of Health and Environmental Control. Dr. Marvella Ford, Associate Director of Population Sciences and Cancer Disparities at MUSC, and State Representative Kimberly Johnson, District 64, Clarendon and Sumter Counties. Thank each of you so much for your time and for sharing all of this great information. Thank you for watching the South Carolina Legislative Black Caucus Minority Health Summit. Coming up next, Therapy in Minority Communities. I'm Trey Taylor, and we'll be right back. Thank you all.
Right now, we're tackling some of the hardest challenges of our time and finding answers to the questions that impact every community. In the biopharmaceutical industry, developing life-saving treatments and cures, working to help those in underserved communities, and supporting patients in need are all just a part of our everyday life. And we need your help. We're working to provide better access to our industry and to make more opportunities available than ever before. We're offering scholarships to make education accessible. We're putting more resources into our communities and providing support and mentorship to those who need it. If you're looking for a career in medicine, business, or marketing, then you have an opportunity to create change and save lives. We're fighting to drive research and innovation forward while paving the way for progress. And we know this can only be achieved when we fully embrace diversity, when we make it part of our DNA.
For generations, Prisma Health has been taking care of South Carolina women throughout every stage of life. From adolescence to motherhood, through menopause and beyond, we provide all the services women need, including midwives and fertility experts. With more OBGYN specialists, more convenient locations, and more personalized care, we're doing even more to help you be your healthiest you. Prisma Health, the women's health experts.
Hey, South Carolina, you can make a choice for your Medicaid health plan. Choose Healthy Blue. With Healthy Blue, your whole family is covered for free or low-cost checkups and prescriptions. plus eye exams and glasses for kids and adults. Get all this and more from a plan backed by the Cross and Shield. The choice is easy. Get Healthy Blue now at choosehealthyblue.com/SC and get more from Medicaid.
The South Carolina Legislative Black Caucus was founded in 1975 with the mission to improve the quality of life for Black and minority communities in South Carolina. Since its founding under the leadership of Judge Ernest Finney Jr., the caucus has been the catalyst behind significant legislative action and policy changes in South Carolina that brought efforts of justice and fairness for all South Carolinians. Caucus efforts have led to state statute requiring consideration of minority businesses in the process of awarding state contracts, the creation of the Governor's Office for Small and Minority Businesses, the South Carolina Commission of Minority Affairs, and the state's Human Affairs Commission. The caucus is currently comprised of 45 members, including 12 state senators and 33 members of the South Carolina House of Representatives. In January 2021, State Representative Patricia Hennigan assumed the role of chair of the caucus, marking the third woman to be elected to lead the historic organization. Chair Hennigan has announced an active and comprehensive plan for the caucus that centers on increasing overall exposure and opportunities for minority communities across South Carolina. The South Carolina Legislative Black Caucus remains committed to its founding motto, "Like limbs, we reach toward the sun, but feed from a common root." The caucus remains readily available to serve the citizens of South Carolina, continuously fighting for justice and fairness. We're back to the South Carolina Legislative Black Caucus 2022 Minority Health Summit, Panel 2, Therapy in Minority Communities, featuring Keona Dunn Hennigan, founder and director of Simple Truth Counseling Center, where she is a licensed professional counselor in the state of Georgia. She's also a certified anger management specialist, certified trauma clinician, and a certified prepare and enrich facilitator. She is also a certified sex offender treatment provider. Dr. Kenneth Rogers, State Director of the South Carolina Department of Mental Health, has a long history of working to expand mental health services to underserved populations by partnering with both traditional and non-traditional locations of services, including faith-based communities, schools, and correctional facilities. Dr. Rogers has presented and published wide in the areas of child psychiatry, juvenile justice issues, spirituality, cultural issues, and healthcare system reform. Dr. Rogers began his tenure as the State Director of the South Carolina Department of Mental Health in 2022. And State Representative Jermaine Johnson was elected in 2020. He serves South Carolina House District 80, which covers Kershaw and Richland counties. Currently, Representative Johnson serves on the Rules Committee and the Medical, Military, Public, and Municipal Affairs Committees in the South Carolina House of Representatives. Please welcome our panelists for the conversation about therapy in minority communities.
Thanks for joining us once again to the South Carolina Legislative Black Caucus Minority Health Summit. I'm Trey Taylor. You heard our introduction of our wonderful panelists, and we are talking about therapy and minority communities. Ms. Hennigan, I want to start with you. How important is therapy, particularly in the minority community?
Well, it's very important. It's as important as breathing. It is important because it helps to change our physical health. When you are anxious, depressed, and have dealt with trauma, it's important to address those things so that it doesn't manifest into physical ailments. So it's very important.
Dr. Rogers, why do you think it's important? And do you?
I absolutely think therapy is important. I feel like everybody should understand themselves, because if you understand yourself, you can actually make better decisions in life. So sometimes, whether it's you feel like I have no issues going on with me at all, it's just really that chance to talk about what's going on in your life, understand your decision making in the past, and really to formulate how you're going to think about things in the future.
Mm-mm. Why do you believe people? I mean, and I think we know there is a stigma attached to um, therapy, particularly in the minority communities. Why is that, Dr. Rogers?
People aren't really opposed to therapy. They're opposed to what people see as therapy.
Oh,
I grew up with five sisters and my mother. I was the youngest kid, so they took me to the beauty shop every Saturday morning. That's where I learned to be a therapist, because the beautician was actually a therapist there. So people have this myth that because I'm going to talk to somebody that has a few letters behind their name, it's really significantly different in terms of my interaction compared to the person I see in the barbershop or the beauty parlor. And so we have to really demystify what therapy is so that people can really say, okay, this is really just talking about what's going on,
hmm
looking at different ways of dealing with things. So perhaps I can make different decisions in life.
yeah. Representative Johnson, what do you think about therapy in the minority communities? I mean, as a layperson, as a medical layperson, what did you grow up hearing about therapy?
Well, the thing is, when you talk about therapy in the Black community, it just means there's something wrong with you, and that's the situation that we deal with when young people say, "I ain't," but we're always told as young people, man, listen, you don't talk about your business outside the household. This stays here. We keep this in the house. We don't talk about your family problems. You don't talk about that type of stuff. What happens here stays here. And we get into this whole stigma of, if we go tell somebody, then we're snitching, or we're doing this, and we're talking about family business outside. There's a whole Kanye West song that talks about family business. If something happens, this is family business. You don't say that. You don't talk about this type of thing. And that's one of the things that I learned also, is keeping it in the household and not letting it out. But we know what that did. We know what that does. It causes problems, causes individuals to flare up and fight out and lash out at people. And we can't have that anymore.
That's interesting that you mentioned that, because to say, and I think we've all heard that, you don't talk about family business, but it's interesting that your business also becomes family business, in that you're just trying to deal with whatever you're trying to deal with, but to expose yourself, you are also exposing the family. Ms. Hennigan, are you hearing that? Is that one of the issues around why we as a community, a minority community, are hesitant about therapy?
Yeah, what happens in the house stays in the house.
Yeah.
Although it may be you who was impacted by what happened. I also say that, when we bring the church into this, we're going to go to pastor and we're going to pray. So that's the only group of people, and that's what we're going to do to deal with it. But the mistrust, I believe, goes back even deeper. When we talk about, I think it was Samuel Cartwright who coined the term drapetomania. And, that was basically a mental health disorder for enslaved people who ran away. So how can I trust a system to have me in mind if my beginning stages is me running away from an enslaved situation, and there's something wrong with me? I'm now crazy. You have the Tuskegee, you got Flint. So it's so many other issues. It's such a bigger issue in a mistrust of the system that we're living in. So how do I go to them for help? So yeah, I'm going to keep it in the house. Y'all better not say nothing, and we'll figure this out. We'll involve pastor, and we're going to pray.
Yeah. How do we change that? How do we change what the perception is in the minority community? How do we stop saying, oh, she's so crazy, and that mean something crazy? Dr. Rogers?
I think that it's really a hard one, because it's very much entrenched in our culture. And part of what I've tried to do over the past couple of years is really to get out to the institutions that people trust. So people actually trust their pastors in many cases for folks to go to church. And so I've actually been to 30 churches over the past 2 years to talk about, this is what a congregation can do to help folks in the congregation. This is how we recognize what's actually happening in terms of depression, anxiety, psychosis, PTSD, so that people can actually learn to label things differently. Because if you can label it the right way, you can figure out what to do with it. But if you see it as crazy, we're all going to respond to crazy as being that thing that we saw as a kid, where the kid was acting out on the playground and doing all kinds of wild stuff. And so we're going to respond to it in a negative way. And so I'm trying to help folks think about how do we redefine the problem that's sitting in front of us so we can get to the right answer.
How has the response been to these 30 or so churches that you have visited in the state of South Carolina?
Actually, very, very good. I've found that at the end of the day, people are very interested in helping each other. They just don't know how to. So when somebody comes to you and says, I'm sad, I'm down, I don't know what to do with myself, most of us, unless we've thought through the answer to that, don't know what to say in that moment. But it's really about how do you pre-think things? How do you think through what should happen next, what you can offer, and how can you safely get the person from where they are to where they need to be? And people have been very open and responsive to that.
Jermaine, what do you think? How can this narrative be changed?
Well, I think you need to get more people that look like us to go into the profession, because you have a lot of people who look like us, and we're like, me particularly, I say, listen, my doctor has to look like me. My doctor's got to look like me so that they understand what I'm talking about. Right. They know what I'm going through. We have a lot of Black women that are dealing with issues in the hospital when they're giving birth to these children, and they seem to look at us like we don't feel pain. And when we're talking about, hey, we're hurting at this thing, and they don't believe us. So a lot of things it will stem from us getting more people that look like us to go into these professions, to talk to other people who do look like us, so we can say, you know what, I understand, I sympathize and I empathize with you because I've been through this myself, or I understand what you're going through. I can speak to this pain, I can speak to this hurt. That's one of the reasons why I ran for office. It's so young Black boys and Black girls who look like me, who see me, who have tattoos like me, who speak like me, who've been through the same struggle that I have, so they can identify with who I am. And they can say, you know what, I can be like that man when I grow up, or I can be like him, or I can surpass what he's doing. So that's the whole thing. I think we have more people that look like us that are in these positions that can talk to people and get them to understand and let them know that it's okay to voice their concerns and their feelings and stop trying to bottle it all down. I think we change some of these things.
Yeah, you were clapping them up, Ms. Hannigan.
I was saying, yes, I was. I'm excited that he said that. I mean, I don't want to make up the numbers, but I think it's 19.4%, which are Black clinicians, therapists in the United States. So we're out there. How do we change the narrative? We change the narrative through education, and we do change the narrative through us showing up. I have a really close friend who's based in South Carolina, Dr. Stephanie Jameson, and Jameson Consultant is the name of her group. I know she's based in, let me think, Hilton Head, Beaufort, Jasper, Orangeburg, Holly Hill, Myrtle Beach, and Columbia. But the issue that we have as clinicians, and she's a Black female therapist with these practices, is getting into these locations. They make it so difficult to be able to open up these locations and to reach the rural communities. So once we're in the community and they see us, wow, she looks like me. Wait a minute, I can trust her. I can trust that she understands when I use a certain term or a certain slang, that she gets what I'm saying, where I'm coming from. And once that part is broken down and the trust is gained, then change can happen. So we have to be able to allow clinicians to get into these places, insurance companies to work on what they're doing as far as allowing Black females or Black males to become licensed on their panels. Panels are closing us out. They're saying we're saturated. So because we're saturated in that area, we don't necessarily need you on this panel. But who are you saturated with?
Right.
So that's where the conversation needs to happen in order to change the narrative.
Yeah, that is an interesting point that you make. And I would love to, if we have time to come back to it, maybe we need to have another conversation about that in itself. It's Therapy and Minority Communities. The South Carolina Legislative Black Caucus present the 2022 Minority Health Summit. That was Keona Dunhanigan with the Simple Truth Counseling Center. Dr. Kenneth Rogers, State Director of the South Carolina Department of Mental Health, joins us, along with State Representative Jermaine Johnson. He represents District 80, Kershaw, and Richland counties. You mentioned a little bit about this in your opening statement, Ms. Hannigan, but can you delve a little bit more, all of you, about the mental, physical, and emotional benefits of going to see a therapist? And we can start with you, Ms. Hannigan.
Well, If you talk to anybody out here, we talk about our blood pressure. You know your weight, you know your cholesterol. Well, you should know your cholesterol number. They're numbers that we know, right? No one talks about your burnout number. No one talks about what your compassion fatigue number is. No one talks about, have you been screened for anxiety and or depression? So it's really important to understand that these things also have numbers. So while we're focusing on our physical health, we have to understand that if our mental health is gone, just think about this for a second. If your mental health is gone, nothing else matters. Your physical health could still be there, but if your mental health is gone, then the body is a breakdown. It's broken down. So yes, it is important to address every single area for the whole person, you know, to be happy and successful.
Dr. Rogers, how important is therapy for your physical and emotional health?
It's the number one thing. So we talked a little bit earlier about the physical manifestations of illness. And if you look at high blood pressure, we look at diabetes, we look at all those things. If your cortisol level's going up, you're probably going to gain weight. And it's all because of stress. So you can exercise, you can do all these things, but unless you can get that stress number down, you're going to be in trouble. And so part of what we find in our communities is part of the illness that's going on out there. We're dying, 8 years younger than other people in many cases. And part of that's because of stress. And so we have to figure out how in our community do we get that stress down? And it's not just always related to socioeconomics. I see a lot of folks that are upper middle class people that are stressed out about all kinds of stuff. And so I think that the health benefit is figuring out, how do I manage, deal with, have somebody that can listen to the struggles I'm going through, and perhaps find another way of dealing with it.
Yeah. Who should see a therapist?
Everybody. and I say that kind of tongue in cheek, but my own personal confession, before I decided to move back to South Carolina, I went to see a therapist, and we sat down for about 6 months, and we talked about the job, my struggles and stresses thinking about the job, and she talked me through a lot of things that I am dealing with now that I would have never pre-thought. And so there are things that are occurring that I'm like, okay, yeah, we talked about this was coming up. So this is how we talked about dealing with it. And it has made a remarkable difference in the way I approach things, because it's not coming as a surprise. I pre-thought all this stuff. And so you make decisions. And really, that's the empowering thing, is when you recognize I can make a decision. It's something our ancestors weren't always able to do. I can make a decision about when I do X, when I do Y, when I do Z. And a therapist can help you really think through what those decisions can look like.
So even the doctor needs a doctor.
Absolutely.
Yeah. Yeah. What do you think, Jermaine? Jermaine, I don't want to ask you personally, have you ever seen a therapist? But I do want to ask you, going into the communities that you serve, is that a conversation that you have with your constituents?
Yeah, and you can easily ask me personally. Yes, I have seen a therapist, and I advocate all the time on therapy, relationship therapy, mental health therapy. I talk about this all the time. I'm a big advocate for this because I don't think we give it a name enough. We talk about our problems and things like that, but we don't give it a name, and we need to call it what it is. A lot of our young people have PTSD. I had PTSD. Seeing friends murdered and family members murdered, and the drugs, and watching how your family get treated by police officers and different situations, and seeing the type of thing that we've gone through with a lot of the upbringing that we've had, my homelessness, going through those things. I had a lot of problems. I had a lot of problems, with financial problems, where I literally would get anxiety and get nervous when my bank account would get to a certain number. And I didn't know how to handle that. I get stressed out and didn't know what to do about it. So I had to seek therapy to help me deal with these different problems that I was going through, and it has helped me tremendously. It's helped my relationship grow, and I talk to people all the time about the situation, that it doesn't mean that you're crazy.
Right.
These are just issues. These are tools to help you get through these situations that life is going to throw at you. And, essentially life throws them at minorities more often than not. So we need to be equipped and prepared and ready to tackle the world when the world comes ready to attack you.
Right. And it's going to. It's going to. Back to the point of who needs a therapist, Ms. Hannigan, like Jermaine said, life is going to happen. And so do we go into life thinking, listen, I know something's going to happen. Let me just go ahead and see if I can find me a therapist.
That's it. Like Dr. Rogers stated first, that he went in not necessarily knowing that he would need these strategies in order to cope later on. So that is why it's helpful. And like Jermaine stated, just life in itself, PTSD, anxiety, depression, just different reasons as to why it is important to make sure you take care of your mental health. And yes, everyone, and maybe I'm a little biased, but I think you know how Oprah said, you get a car, you get a car, you get a therapist, you get a therapist. I think it's really important that you take care of your mental health, that you understand. And I think Dr. Rogers used the word empower, so that you're empowered to know that, you know what, I have a choice.
Yeah.
I have a choice, and I can work through what has affected me so that I don't bleed on those who didn't cut me.
Yeah.
And that is very important.
Yeah, that's good. That is Keona Dunn-Hennigan of Simple Truth Counseling Center. Dr. Kenneth Rogers, State Director of the South Carolina Department of Mental Health, also joins us. State Representative Jermaine Johnson, District 80, Kershaw and Richland counties. And we're talking about therapy in minority communities. It's the South Carolina Legislative Black Caucus Minority Health Summit. I'm Trey Taylor, and we've been talking about who needs therapy. So if everyone needs therapy, how young do you start? Dr. Rogers?
You know, I think part of it, like we talked about earlier, is really demystifying what therapy is. So I can tell you early in my life, when people talked about anything related to mental health, it was, I'm going to take you down to Bull Street.
Yes.
And sometimes I sit in my office, which sits on Bull Street, and I'm sitting there going, this is kind of ironic in lots of ways. But we have this idea that if you're seeking therapy, something's wrong with you. And a lot of times our kids go through stuff that we just don't address.
Yeah.
If I look at the number of kids that have been touched by adults inappropriately, that have never actually seen a therapist or never been able to talk about it, that stuff's going to have a negative impact on them later in life if they're not able to work through it. The number of kids that have been bullied in school by other kids that have never worked through it. I mean, I'm at 57 and I still think about Daniel and Alfonso, who were my torturers in middle school. There's lots of things that we deal with. So I think that whenever your child is going through an issue, being able to actually plug them into some place where they can talk about what's going on and get support for what's going on. And that can occur as young as 4 or 5. And in many cases, certainly by middle school, it's appropriate to have seen someone to talk about struggles that are going on.
Yeah. Representative Johnson, back to you. I know back to what we were talking about with Dr. Rogers as far as how young do you start. I know you're working on a violence intervention prevention initiative. One, where are you in that process? And will mental health be something that you encourage, seek out, suggest for your VIP experience, so to speak?
Yeah, absolutely. So the bill is still in committee. However, I was able to get an amendment drafted and passed in the budget. So that is actually passed. So what it does, what the VIP program does, it creates a new division inside of DHEC. And it will have board members and directors. And what it does, it will allow them to apply for federal funding, this new division to get federal funding. And then grassroots organizations can then apply for the grant funding to do the programs in these small communities that never get this funding. You know, a lot of times funding goes to these big overarching organizations, but it never trickles down to the people who are closest to the problem, because we know the people closest to the problem are usually closest to the solution. So that has actually passed. It's in the budget right now. I'm going to encourage everybody watching and listening to please call your representatives, call your senators, and encourage them to keep that in there so that we can fight some of these things, because it's more important now than ever, seeing that all the shootings and the killings that are happening all across this state, all across this nation. So this will actually assist with what we have going on. In addition to that, I have I have legislation that would have each police department to have on staff or contract with a mental health provider, as well as each school district to have a mental health provider in the school districts. So we're trying to make sure that we can save our young people. We can do what we can to fight for them, because as cliche as it sounds, the children really are our future. But it's time for us to actually put some resources and funding behind that whole cliche saying.
Yeah, talking about resources and funding, Dr. Rogers, does the State Department of Mental Health have enough funding to make sure South Carolinians are mentally fit?
Trey, you don't want to get me to talk about that one right now. I think the funding has always been a struggle for mental health. And I think with the Texas shooting, one of the things that I've followed is chats that are occurring between the commissioners in various states around mental health. And so there's a lot of discussion around the need for mental health. But if you look at funding for mental health in most states, it's not gone up. In fact, it's either stayed level or there have been cuts in almost every state in the United States. And so there seems to be a disconnect between funding and the issues that are occurring. And so I think that more funding for mental health in general is important. And as Representative Johnson was saying, I think that that's especially important in schools, trying to make sure that we get kids closer to where they are so that they really can engage. If you've got a kid whose parents got to drive them to an office after school, it's not going to happen. I mean, in reality, in most places. But if a therapist is sitting there in school that's culturally competent, that can engage that child, you can accomplish a lot.
Yeah. Kiona, do you think we should call it something different? Because it's such a, again, stigma around it, even to Jermaine and Dr. Rogers' point about getting the funding and people wrapping their heads and hearts around not only getting the funding, but getting people what they need to survive and thrive. Does it need to be called something else? Do we need to invent another word for it?
I think we have to call it what it is so that we can truly deal with the issue at hand.
Right.
I do believe funding is a huge issue, especially when we talk about dealing with the rural communities. If I can backtrack for a second, the youngest that I've seen in my practice is the age of 5. Okay. And I utilize a lot of play therapy in order to address adverse childhood experiences that they show up with. So not necessarily change what we call it, but just address it for what it is and to put our money where our mouth is, because I am tired of all of these hashtags. I'm tired of, okay, we need to fix this. Let's pray for this. And then when we talk about the budget, I'm going to give it $20, right? So we have to make sure that we truly show up when we're supposed to show up, and to not just, glamorize. And I'm using the word glamorize because after every situation, you'll pop on the news and it'll show up for a while. And then when it comes to writing these, proposals and voting on them, we forget about it. In the school district that I'm in Clayton County, I facilitate a program. It's an anger management program, but we changed the name. So we didn't term it anger management.
Right.
We termed it complete control. So we did turn it into something positive. And it's an alternative to suspension and a prevention program that I facilitate twice a week, Tuesday and Wednesdays, so that we can have the conversation with our boys who are generally showing up and deal with the emotions that everyone feels. So do we change the name and call it something different? I don't think that works. I actually think we just need to address, like Dr. Rogers said, we need to put our money where our mouth is and make sure we deal with the issue so that it does not continue dealing with us, because it will happen again, like Jermaine stated.
Yeah. Listen, as you said, you changed, a little bit of what you were doing from anger management, which sounds like, oh, I'm angry, you know what I mean, to something else. And Jermaine even mentioned this. Maybe it's just life skills, because that's, to me, that's what it is. You are trying to figure out how to handle what happens in your life. And we can handle it like we see in the media, or maybe even in our families, which may or may not be positive, or we can handle it in an appropriate way. And maybe, listen, I say our kids, but kids of all ages, 8 to 80, just need to figure out how to handle life. Because the thing about it is, if you don't learn how to handle it, regardless of how old you are, you're not going to know. How do you find the right therapist for you and your loved ones, Dr. Rogers?
I want to go back to your question right before that one, Trey.
Okay.
Do we label it as something different? So a couple of years ago, I came up with this idea of I became a life coach, because for a lot of guys, they aren't going to show up in my office if I say I'm a therapist. I mean, in reality. But folks are used to having coaches. I mean, we have football coaches, basketball coaches, et cetera. And so when I relabeled what I do as coaching, it was amazing to me how people were able to process it.
Wow.
And it helped me to realize how much stigma actually exists in certain groups. Like, I've noticed at this point that many more women are able and willing to engage in therapy. I still haven't gotten the guys that are willing to come to my office and say, I'm going to have therapy, because we have convinced them that therapy is really a bad thing.
Right.
It looks like you're weak. It looks like you don't know what you're doing. And the last thing you want to tell a guy is you're not in control of your own life.
Right.
And so I've had to kind of rethink what I'm calling it in the midst of things. And even my approach to it has had to become a little bit different, just because of the societal pressures that are out there that won't allow people to seek care.
Yeah. We are talking about therapy. We're getting ready to change the name, though, y'all, for minority communities, with the South Carolina Legislative Black Caucus Minority Health Summit. State Representative Jermaine Johnson, District 80, Kershaw and Richland County, joins us, along with Dr. Kenneth Rogers, State Director of the South Carolina Department of Mental Health, and Keona Dunn-Hennigan. She's owner of Simple Truth Counseling Center. I was asking any of you who want to answer, how do you find the right therapist? How do you find the right life coach? How do you find somebody to help you deal with life after this year we've been through? Years, plural. Keona, you want to jump in?
Yeah. There are many platforms, right? But that would mean you need to know how to find the platforms. So
how do you find it?
So how do you find it? Well, Dr. Rogers stated something about the churches that he went to. That's important. What I've been seeing is our pastors are actually taking a stance and saying, listen, I can work with you on this, but you need to go see somebody for this.
Mm-hmm.
And I'm really appreciative about that. I'm also noticing when superstars come out, I specialize in a form of therapy called EMDR. I don't know if it was Harry or Kate, one of them came out stating that they use EMDR, and my phones just blew up.
Wow.
Another actress stated she used EMDR and it changed her life. I got a whole waiting list. So I think what happens is when you go to your churches, word of mouth, and like I stated before with Jameson Consultant, she actually goes into the community and have events such as this to let people know, hey, I'm here, come find me. I'm having events in the community. This is how you reach me. Virtual is also a good one. But I realize in the rural community, we got to talk about connection.
Internet access.
You have access. So it's a difficult thing. And it's double, triple folds. It's you have to break it apart to kind of get to it. But resources are out there. The back of the insurance card, you contact the Medicaid number. There are different things and ways that you can go about it, but you have to do the work in the beginning.
Right.
You have to understand, I'm feeling these butterflies. I'm not getting out of bed. I'm not eating. I'm moving a certain kind of way. Maybe I could look at the back of the card. I could speak to my pastor. But you have to first initiate what that looks like.
Right. So you're saying, obviously, you've got to recognize you have a problem.
Yes.
You got to recognize, you got to look at it as, this is for my health. My mental health also impacts my physical health too. Jermaine, how did you find your therapist?
My first qualification was, do you look like me?
Right.
So that was my thing, and I actually went to my pastor for marriage counseling, and then when I went there, we talked about other therapies and other people that I could go see. So it definitely came to the church. So I do believe that Dr. Roger he's got a good thing going. I think if you go to the rural communities, rural communities are so spread out. But the place where you get the most bang for your buck and in the most concentrated area is in church on Sunday. So you get to a church on a Sunday, you get everybody within 20-mile radius that is in one concentrated area, and you get the pastor to, hey, listen, to recognize you there. Say, hey, listen, the therapy is very important. There's somebody here. If you want to talk to him, if you want to talk to her, you can talk to this person. I can help with this, but I encourage you to talk to this. And I think that's the best way that you can actually infiltrate some of these rural communities, and specifically these rural communities, because in most of those rural communities, we're all related. We're all cousins. We're all family members down there. So once you get one of us, child, I'm gonna get on the phone and call Big Mom and everybody else and let them know, listen, this is who I'm seeing down here. If you need some help, go on down and talk to Mr. Rogers. Mr. Rogers, right? And that's the type of thing that we do. So I think Dr. Rogers has got a good thing going.
Right. Get everybody on the family plan. So Jermaine, all right. So in schools, in church, at your job, how do we get this funded to have mental health professionals where the people are? Again, in the schools, in the church, at your job. This be a mandatory employee that is there to help employees.
Yeah, I think right now is the perfect prime time to actually get this funding going to the right direction, because this is what we're seeing every single day. We hear people talking about mental health. The person was bullied, or this was going on in this person's life, or this or that. Some of these things could have been prevented had we had adequate funding for mental health services.
Right.
So right now is the perfect time to call your representatives, to call your senators, to bombard these gatekeepers and let them know, say, hey, listen, it's time to actually put some action behind your words. Time out for all these thoughts and prayers. Let's get some action behind this stuff. Let's start working for our young people. Let's start doing these things. And right now is the perfect time to blow them up, calling them on their phones, emailing them, and let's get some things going on, because this is one thing that I have been fighting for the past few years, is trying to get funding for mental health and funding to fight, violence. So, things like that, let's get it going.
Right. We've got about 7 minutes before we wrap up this session. Before I ask each of you to give a closing statement, I do want to ask you, Dr. Rogers, what resources are available for our community in general in South Carolina through the Department of Mental Health?
So the Department of Mental Health operates 16 mental health centers, and there are satellite offices in actually 44 of our 46 counties in South Carolina. And so contacting the department is really easy with your local mental health center. The other thing
I think we're having some connectivity issues with Dr. Rogers, just as he was giving us some good information about the Department of
families
Mental.
that have mental health crisis as well. Did I cut out?
Yeah, you did.
Yeah. So mobile crisis is something that we also have available in a department that can actually go out to a home if called. We also have 1-844-SC-HOPES, which is our Hope line, which can connect you to any service that actually is within the Department of Mental Health as well.
All right, 844-SC-HOPES, 844-SC-HOPES. Anyone in South Carolina can call that number and get connected to a life coach, a therapist.
Yep. to their local mental health center. And the other thing, to the point we were talking about earlier, is of the things that have happened in South Carolina, I think that have been positive over the past year. One of the things that's expanding is school mental health. And so there have been more dollars actually allocated to school mental health. And so therapists that look like us that are interested can actually contract with local school districts, contract with the Department of Mental Health. You don't necessarily have to become an employee. So if you're in practice and want to spend some time in schools, that's certainly a possibility as well.
All right, that's Dr. Kenneth Rogers with the South Carolina Department of Mental Health. A closing statement from each of you. What's the best advice you can give everyone watching today about therapy and seeing a therapist? Kiona, would you start?
Closing remarks. There is a quote that I share with the kids in the school system a lot, and it's that broken crayons still color. That you have a purpose, and therapy empowers you to understand that you do have a purpose. So yes, broken crayons still color.
Yeah. All right, it's Jermaine.
I just want people to know that it's okay. It's okay to not feel okay. It's okay to know that you're not okay. It's okay. I want to give people the permission. Give yourself the permission to not feel okay and to seek out some assistance, seek out some help. Don't let people tell you to keep it bottled up. We don't have to keep it bottled up. We need to talk these things out. Let's get it out before it becomes a problem, and then we explode in some sort of way. So it's okay to not be okay, and it's okay to let others know that you're not okay and to seek out the help. So let's go get some help.
Awesome. And Dr. Rogers, your closing statement, please.
I think we have to learn to take care of each other. I was actually at a church a few years ago, and folks were telling me about this angry woman that was in church. And it was kind of this description of the angry Black woman scenario that people love to get to. And they said, can you just talk to her for a second? So I went over and I talked to this sister in church. Turns out she had lost her husband, she had lost a child, and she had lost her job. But that never registered with anyone around her. They recognized that she'd become increasingly angry, but they never linked loss to behavior.
Wow.
So part of it is, how do we give people grace when we're looking at them and not necessarily look at it through a negative lens? Because if somebody's behavior is changing and they've always been that nice person before, what's going on that's caused them to become different now?
Yeah, I love that. Give people grace. I mean, it's this old saying that we all grew up to: do unto others as you would have them do to you. If you want somebody to look out for you, to be nice to you, to ask you how you're feeling, ask somebody else too. Wow. We've been talking about therapy in minority communities. We're taking suggestions too of what you want to call it, because we have decided today that we're calling it something different. State Representative Jermaine Johnson joined us. He's with District 80, Kershaw and Richland counties. Dr. Kenneth Rogers, he is the director of the South Carolina Department of Mental Health, and Kiona Dunn-Hennigan, she's owner of Simple Truth Counseling Center in Georgia. Thank you all so much for sharing your hearts, sharing the information, for being transparent, and for what you're doing to help break the stigma and really work within our communities. We need you, and we really do appreciate you. Thank you again so much.
Thanks, Ray. Appreciate it.
Thank you.
You are watching the South Carolina Legislative Black Caucus Minority Health Summit. I'm Trey Taylor. Coming up next, is the pandemic over? What to expect next? That panel is coming up right after this. We'll be right back. Y'all, I don't know if we're out.
Hi, my name's Cambrell Garvin. I serve South Carolina House District 77, located in Northeast Columbia and Blythewood. It is a pleasure for me to welcome you to the South Carolina Legislative Black Caucus Minority Health Summit. I certainly hope that you are enjoying these wonderful presentations because we recognize that your health and the health of your family and the health of our communities is so, so very important. So continue to enjoy. And again, on behalf of our chairwoman, Patricia Moore Hennigan, we hope that you are enjoying this conference. Thank you.
Prisma Health keeps South Carolina hearts beating strong. As the largest cardiovascular provider in the state and home to the only freestanding heart hospital dedicated to the prevention, diagnosis, and treatment of heart disease, we provide the heart care you need. With more innovative treatments like LVAD, more specialists, and more locations closer to you, we're doing even more to help you be your healthiest you. Prisma Health, the heart and vascular experts.
Hey, South Carolina, you can make a choice for your Medicaid health plan. Choose Healthy Blue. With Healthy Blue, your whole family is covered for free or low-cost checkups and prescriptions, plus eye exams and glasses for kids and adults. Get all this and more from a plan backed by the Cross and Shield. The choice is easy. Get Healthy Blue now at choosehealthyblue.com/SC and get more from Medicaid.
Right now, we're tackling some of the hardest challenges of our time and finding answers to the questions that impact every community. In the biopharmaceutical industry, developing life-saving treatments and cures, working to help those in underserved communities, and supporting patients in need are all just a part of our everyday life. And we need your help. We're working to provide better access to our industry and to make more opportunities available than ever before. We're offering scholarships to make education accessible. We're putting more resources into our communities and providing support and mentorship to those who need it. If you're looking for a career in medicine, business, or marketing, then you have an opportunity to create change and save lives. We're fighting to drive research and innovation forward while paving the way for progress. And we know this can only be achieved when we fully embrace diversity, when we make it part of our DNA.
Thank you for joining us for the South Carolina Legislative Black Caucus 2022 Minority Health Summit. Panel 3, Is the Pandemic Over? What to expect next? Please welcome our panelists. State epidemiologist Dr. Linda Bell. She's been with the South Carolina Department of Health and Environmental Control for 27 years and is an expert when it comes to infectious diseases, including the coronavirus. During the pandemic, Dr. Bell has become a household name across the state of South Carolina and beyond. Angela Jenkins, Vice President of Accountable Communities at Prisma Health. She is an experienced leader in community health, having implemented community health initiatives for over 20 years at a large healthcare system in Northern California before moving to South Carolina. In her current role, Angela develops strategy and leads the execution of an enterprise-wide community and social health strategy designed to address the needs of communities experiencing significant disproportionate barriers to accessing healthcare, health insurance, and achieving good health. Angela leads a team with established partners, civic and community leaders across the state to advance programs that deliver on Prisma Health's goal to improve the state of health for all South Carolinians. Our final panelist for this session is Representative Wendy Broadley. Elected in 2017, she serves South Carolina House District 70, covering Richland and Sumter counties. Currently, Representative Broadley serves on the Medical, Military, Public and Municipal Affairs Committees in the South Carolina House of Representatives and is also the CEO and publisher of Amara Woman magazine. Please welcome our panelists for the final panel this afternoon. Is the pandemic over? What to expect next?
Good afternoon once again, and thank you for joining us for the 2022 South Carolina Legislative Black Caucus Minority Health Summit. I'm Trey Taylor. As you heard, our panelists, our group of great panelists have been introduced, and we're going to start the conversation. Is the pandemic over? What to expect next? Dr. Bell, we've got to start with you. Nationally and in South Carolina, we are seeing COVID restrictions ease up. People are acting like the pandemic is over. Is it?
Well, let's talk about the terminology, because in public health, as we're monitoring the disease activity, we're in a transition phase. So we're moving from what we consider to be a pandemic, which is the widespread, simultaneous, high levels of disease activity that is causing many illnesses, many cases, overrunning our healthcare facilities, is what that looks like internationally. And we're moving away from that, fortunately. So we're transitioning from what we consider to be the pandemic to what we call an endemic. And what an endemic means is that there is a relatively low level of a disease that will continue to occur. So we've lost our opportunity to eliminate the virus that causes COVID-19 entirely. So we know that we'll continue to live with it at some level. We may continue to see periodic surges and clusters of outbreaks in certain areas. In fact, what we're seeing in the country now, we saw some came down from a very high surge caused by the Omicron variant. And but now we're moving back up again, a little bit in the northeastern states. We saw that it's cooling off a bit, but our numbers here in South Carolina are beginning to creep up a bit. So this is what we're seeing with an endemic disease. And so while the pandemic is over, the endemic occurrence of this disease is not. And as cases may continue to surge with, as you've mentioned, the relaxation of many of the prevention measures for COVID. If we don't continue to monitor community activity and we're unwilling to put in place some of those prevention measures again, then we may lose our opportunity to keep the disease levels at the lowest level possible.
I want to stick with you for just a minute before I bring on the other two panelists. What, at this point, as an endemic, what of the many precautions we put and measures we put into place, what needs to be put in place now? Do more people need to be vaccinated? Do we still need to mask? Do we need to stay 6 feet? What needs to happen now?
Well, the number one thing is we need to get as many people vaccinated as possible. And this is really regardless of the community transmission level. Because if we can get high level immunity, that will help us keep the disease rates low. But the concern about surges is the way that the virus continues to mutate. And we want to get as many people protected before there are additional mutations that may not be susceptible to the currently available vaccines and treatment. So number one is to get the vaccine up to date. That means completion of a primary series and booster doses as recommended for your age group. Now, as far as the use of masks and physical distancing and those other measures, we're monitoring community level activity. And up until this week, all 46 of our counties in South Carolina were classified as low transmission areas. But unfortunately, as I mentioned, that is creeping up a little bit. And in fact, there are a small number of our counties that are already in the moderate range based on either an increase in disease activity or an increase in hospitalizations. So as we continue to monitor that, if any of our counties move into being classified as areas of high transmission, higher hospitalizations, then it would be prudent to again wear masks when we're indoors, especially, to consider physical distancing and give careful consideration to the gatherings that we participate in over the summer. So it's going to be up to the individuals now, because this could also be based on your underlying health conditions. If you're immunocompromised and you're at increased risk of complications, then it might be recommended for you to wear a mask at all times. Or if you have household members who are at higher risk, taking specific measures to protect them. So that's a bit of a long answer, but we need to monitor disease activity. You need to be aware of your own underlying health risks. And if things start to look bad again, as quickly as possible as we can implement measures to keep the disease rates low, that helps us from having so much virus around that increases the probability of mutations and new variants that might not be susceptible to the currently available vaccines and drugs.
That's Dr. Linda Bell, South Carolina State epidemiologist. Angela is the Vice President of Accountable Communications at Prisma Health. I want to bring you into the conversation. Dr. Bell said that we need to know when and who needs to do what. I guess, how do we inform people what they need to do? If you are in this group, you should do this because this is happening now. How do we inform people about that?
Yeah, and I think Vice President of Accountable Communities. So in terms of just leveraging what we know, as Dr. Bell indicated, who's most at risk for some of the long-term effects from COVID, right, or who have underlying conditions. I think we work with our community partners. We've worked with our trusted messengers, as we talked quite a bit during the pandemic when we were at crisis, to make sure that people are aware of what's happening in their communities, that they have access to the information they need to engage in the precautionary behaviors that we know work, that they know where and how to get access to boosters and to the vaccine and to testing if they need it, or to get the tests. So I think we have to really understand our population that we're serving and target messages appropriately. And we were talking earlier about community health workers and trusted health workers in our communities. I think we learned quite a bit in terms of our experience with the healthcare community and what that might mean for us. I still think we do what we were doing all the last couple of years in terms of partnering with organizations that have a trusted space in our communities, working through them to make sure that we can get information to the communities that we serve. And I think from Prisma Health's perspective, we did that very well with our community health workers, our mobile clinics, and we were actually able to, with our clinicians and with our community partners, to deliver over 11,000 vaccines during the pandemic. And so I think because of the way we did that, because of the way how we engaged with community and worked with trusted partners, we were able to get people the information, access to the vaccines, access to tests in the places and spaces where they live and where they congregate and where they're living their daily life. And I think that continues to be important. And I think we need to continue that approach with what we do, particularly now as people are thinking that we're lightening up and they may not have to engage in those behaviors. It's, as Dr. Bell indicated, it will be with us. And we have other viruses that we know all too well when we think about hepatitis C and HIV. While it might be at an endemic status, we still need to engage in precautionary behaviors and be careful as we're navigating our lives. So it's not going to go away. It's still here. And it's too early to know what's going to happen with it long term. So we just have to stay diligent in what we're currently doing so that we can all remain safe and our families can remain safe.
State Representative Wendy Brawley, she's with District 70. She represents District 70, Richland and Sumter counties. Representative Brawley, are your constituents hearing about the many efforts that are going on throughout the state about getting people tested and vaccinated? And if not, what do you need for your community?
Well, thank you, first of all, for this opportunity to speak at the forum. But I think for the most part, they are. I think the effort by the state to make sure that the information was pushed out in the most rural parts of our state has done really well. We struggled a little bit at the beginning. I'm sure everyone would admit that. But I think we have graduated to a point that people are reliant upon the messaging that they're seeing, both on the news and the commercials and the outreach through churches that's taking place. And I think that was a challenge for us initially, to figure out just what the recipe needed to be to reach the most rural parts of South Carolina. But I think we have done a much better job of doing that, and people are listening. I think our people know how serious this disease has been, how devastating it has been, particularly in communities of color. And they are trying to do everything that we can to kind of make sure that it's mitigated and that our communities are safe. So I do think we are at a place now much better than we were, obviously, at the beginning of the pandemic.
Yeah. Ms. Jenkins, you said that, of course, we can't predict the future. It's too early to figure out what is next. But either you or Dr. Bell, can you answer the question, do you think we will need an annual COVID vaccination?
Yeah. I'll actually defer to Dr. Bell on that one in terms of vaccination. I can talk a little bit more about our community response.
Yeah. Dr. Bell?
Oh, well, the couple of things that we need to continue to watch, and whether or not we will need regular vaccinations depends on a couple of things. The duration of immunity is one. So we're probably all familiar with the CDC coming out with the recommendation that we receive booster doses after we got a primary series. And that's because the study showed that initial protection declines over a period of time. And so to remain fully protected, you have to get these booster doses. The second thing to consider is if the virus continues to change. So if the virus that causes COVID-19 changes to the point where the currently offered vaccines aren't effective anymore, then that would be another reason to have recommended some frequency of vaccines for COVID in the future. This is exactly what we see with annual flu vaccines. Mm-hmm. The flu viruses shift a little bit every year so that the vaccine that is developed for each flu season is not as effective against the predominantly circulating strain in the subsequent season. And the flu vaccine is not a great one in terms of long-term immunity. It just doesn't work that way. So that if you were only to get one flu vaccine, the next year you wouldn't be protected. So it's a mix of waning immunity, declining immunity, and the changes in the virus. And right now we don't know if we will see in our future the need to have annual COVID vaccines to keep us fully protected against the disease.
So, Ms. Jenkins, can you respond to that as far as the community? How do you then, again, let the community know if indeed we will need an annual vaccine, or if maybe some people, one demographic needs it and another demographic doesn't need it? How does your office, respond to that?
I think partnering with our public health partners, DHEC, and our community partners, as the information is coming out, to be able to partner with them to make sure that we're getting, as I mentioned earlier, the appropriate information to the people that they need as they need it, so they understand why they might need an additional vaccine and what's happening with the variants and how it's impacting individuals, just to remain diligent and the precautionary behaviors. And I think also it's important for us to to maintain the infrastructure that we developed during the pandemic, which was so critical. As Representative Brawley talked, we kind of, we misstepped in the beginning, but we figured it all out. And I think we all learned a lot about what we needed to do to make sure that people got to the healthcare services they needed, they got the vaccines, they got the information they needed, that we had the staffing structures to support that. I think about, the emergency Medicaid people getting emergency Medicaid, and that's set to expire in October, and just making sure that we don't dismantle the public health system that we created to support the good work that people have been doing, and that we stay diligent in making sure that we have the appropriate infrastructure in place so that people can get access to the services that they need, the healthcare that they need, and the information that they need. And that would be one of my concerns in terms of how we proceed, that we maintain that infrastructure as long as we are figuring out that the virus is not going away and that we're needing to shift our approach to do it, that the infrastructure matches what we need to do.
So, Ms. Jenkins, how do we make sure that the infrastructure does stay in place? If it's something that's working, how do you make sure that happens?
I mean, healthcare systems like us would, and I would want Representative Brawley to weigh in on this, not to put you on the spot, but it does require a public-private partnership from our representatives, from our healthcare systems, from our community clinics. If the emergency ends, they're set to lose quite a bit of funding if it ends, and so we want to make sure that they stay whole. So I think it does require a public-private partnership between our system and other healthcare systems to ensure that we're working with our representatives to make sure that if funding is available, that it remains in place, that if staffing is available, that it remains in place. We can't lose that infrastructure because the people are relying on that.
Representative Brawley, I do want you to talk about funding. I was going to ask you that next, as a matter of fact, but I do want to ask you before we talk about that, what were some of the things that were put in place specifically? I mean, we found out a lot about, and listen, I say we found out, I think we all knew, a lot of people knew that we're in the communities, particularly in you serving a rural community, that there were disparities and that there were some people, there were the haves and the have-nots. Some folks were getting what they needed and some folks were not. But COVID did expose it. Some things were put into place, as Ms. Jenkins said. So tell me what specific things that were implemented worked well for our small and rural and minority communities, and what would you like to see continue?
Well, let me start by answering the question to kind of push back to where we were when we started. If you all recall, where we were when we started was, in order to get a test, you had to go online.
Mm-hmm.
And for my community, a rural, very rural community that did not have access to the internet, that was like, we can't get tested. You had to go online to do your testing application. You had to go online for your kids to be able to continue working in school. You had to go online for job applications, for applications for unemployment. All of that was switched to an online type of service. That was the way you accessed the system. And for those people who were living in rural communities where there was no access to the internet or spotty at best, it meant that disparity that already existed got twice as big. And now it became a matter of life and death. So we, some people did not like the fact that I was quite loud on this issue, but it was necessary because people's lives were at risk.
Yeah.
If we did not do something. So what you then began to see is a real push out into the community, a real realization that we cannot rely upon the internet to do this work. We have to connect with community organizations. We have to take vans and buses out to bring people in, and we have to bring those services closer to rural communities. And they've done a stellar job of changing that and doing it fairly quickly. And we, as legislators, we had a responsibility to make sure the funding was there to do that. And I think we've done a good job of allocating money to DHEC, allocating money to the hospital systems. And the hospital systems, many of them got money directly from the federal government to do these kinds of things. So that people sat in a room and said that our best way to reach people is to reach people. And we cannot be reliant upon the internet as our sole source. And that really turned it around in my community when we started seeing, vans come out and buses come out picking up people, when we started seeing mobile units come out into the most rural parts of the community and set up in parking lots and churches and do the testing, and even doing the vaccinations at schools, places where people were accustomed to gathering, accustomed to getting information from, all done most of the time outdoors with tents up. I mean, we really had to restructure everything in healthcare delivery. And I think our most essential job was to sound the alarm as representatives of the people, what our people needed, because they were not clairvoyant. They had been doing it a certain way for many, many years. So it was our job to sound the alarm that these things are needed, and then to provide the necessary funding and to get out of the way so that we had every possible healthcare provider offering these services that we could. And I think legislatively, we did a fairly good job of that. It took some time. I'm sure that there are things that we still need to correct, but making certain that there was an allocation for DHEC. We came back into session during the middle of the virus and sat in the chamber and did that to make sure that there was money available to DHEC and even some of the hospitals that had special programs. We can't stop that because these people that we were trying to reach, they're still there. And in many cases, they're still suffering because they were the sickest people in South Carolina to begin with. They had the high blood pressure, the diabetes, all the things that made them more susceptible to the morbidity of COVID. So I think we have come, I say all this to say that making sure that there was regulatory ability to relax some of the regulations, we did that. Making sure that there was funding available even in the most rural kinds of communities, we did that. And I think making certain that we continue to do that in the future because we are not out of the woods yet. And we need to really make sure that we are continuing on this existing track.
Yeah, you mentioned doing that in the future. I do want to ask, how has the South Carolina General Assembly responded to COVID this legislative session?
Well, y'all, I'll be honest with you. You get honesty from me. When you have a General Assembly that has insisted that we are going to tie the school district's money to whether or not the school district required masks, that's a problem. And that's what we did in the last budget cycle. Just as we walked out to the door, this was the proviso that was passed that wreaked havoc until a court ordered that it had to be stopped and that we had the right to protect kids. Please know that not one Democrat voted for that. But to look at what we are doing now in the General Assembly, there are members in the General Assembly who know how deadly this disease is. They have sat up in that balcony rather than sit in that little scrunched chamber all on top of each other. So we have members who really know and appreciate it, but the politics of the day says that they're going to look at masks as though they're some kind of interference on their freedom, even though something as simple as a mask can help save lives and mitigate the spread of this deadly disease. So I still remain challenged by my colleagues who are living in a land that doesn't seem to listen to the science. And if COVID comes back or some other version of it comes back, another mutant, I fear for what we do because I wish I could tell you that the environment has gotten better. It has not politically. There are still lots of bills out there that they have filed to interfere with the healthcare provider's ability to provide the best healthcare to the patient and to interfere with the school district's ability to make sure that students are kept as safely as possible and still able to come and learn in person. So I'd be lying if I told you that all is well because it is not. Mm-hmm. And we are going to have people get a little bit noisy on this issue because this isn't about politics. This is about health. This is a medical crisis that we are dealing with, and people have made it a political football. And that's
Well, I want to come back to you in just a minute. You said all is not well. I want to come back to you and ask, so what can people do? But Dr. Bell and Ms. Jenkins, okay, so you heard Representative Brawley say that it's a challenge on the government level to do what needs to be done, to get what needs to be done for you all to do your job for us. So how do you handle that? Dr. Bell, Wendy Brawley said that if there's another variant, will there be? And again, we talk a lot about your crystal ball, not having one, but in your professional opinion, will there be that additional variant, that mutant that Wendy spoke about?
Yeah, and we don't want to come across as, this is some sort of, mysterious, mystical thing that we can't make predictions about. Because when you follow the science, there are certain things that we know. There are many things that we understand about how the coronaviruses behave at the genetic, at the molecular level. So we know that mutations happen. We know how they happen. So not all of this is about this unknowingness, inability to make predictions. We should prepare ourselves for the fact that the most recent and largest surge was due to the Omicron variant, and that there are, we call them subvariants. They're like the babies of the big variant that have additional mutations from the parent virus, if you will. We know that's happening. We know that there are some of these subvariants that are increasing now, making up a larger proportion, sort of competing out or taking over what the Omicron variant was causing. So following the science, following our understanding of how a respiratory virus is transmitted from person to person, there are many things that we know that we can predict based on that. And so these things that we do know are that if you use protection that prevents you from inhaling a respiratory virus, then we know that, and we can predict that we can prevent the numbers from going back up again. And so we really want people, we want our community members, we want our elected officials to be as well informed as possible about the true evidence, the real science, how these things behave, so that they do not follow misinformation or disinformation or have misguided goals in terms of what we want to do in our populations to keep communities as safe as possible. So we do have control over our predictions. If we take certain measures, we know that the disease will go in one way. And if we don't follow those measures, if disease rates start to creep up, we can predict that the disease will spread. So from the evidence base, from the science based, we understand that vaccination will get people well protected. And we want to do that as early as possible before additional mutations occur for which the vaccine may not be effective. So we need to do certain things now to affect our future. And I'll just make one other note. You asked at the beginning about a pandemic. We certainly want people to understand pandemics and know that what can happen anywhere in the world can happen to us. But what it really means to us is where you live in your community. So regardless of the numbers elsewhere, if you're in a community where the healthcare system is being overrun, you can't get an appointment to see your physician. So even though we have to look at this both from a global perspective, but we also need to look at it from the community perspective. So what's happening in your community and what you can protect yourself, your loved ones, and your neighbors from, then you can impact where you live and make a difference. And if we do that community by community, then you can have a global influence.
Yeah. Excellent point. We need to be conscientious about what's going on in our communities and whatever community we may be traveling in this summer. That's Dr. Linda Bell. She is state epidemiologist. Angela Jenkins, VP of Accountable Communities at Prisma Health, joins us along with State Representative Wendy Brawley, District 70. She represents Richland and Sumter counties. I'm Trey Taylor, and you are watching the 2022 South Carolina Legislative Black Caucus Minority Health Summit. We're talking about the coronavirus pandemic. Where are we and what should we expect? Ms. Jenkins, I want to ask you about your ability to help keep our communities accountable for your accountable communities. If you are not able to get adequate funding from the state of South Carolina.
That's a great question. I think for us, we'll just continue to do what we've been doing already. And I think, Dr. Bell, you stated it very well in terms of understanding the science, understanding the information, knowing what works in terms of the vaccine being proven to work and precautionary behaviors being proven to work. And I think, you have to have boots on the ground and be in the community as you described, and how we did with our mobile clinics and how we've partner with our community agencies. I think, those partnerships are critical because we see them as an extension of our clinical environment. I mean, we can only do so much in the clinical setting to address a person's healthcare issues and needs. And so I think we, through our public and our partnerships with community providers, want to make sure that, and leveraging our own resources, which we did, we got the money from the government, but we also leveraged our own resources to address the needs of the community and to continue to do that, because we know what works, we know what we need to do to get to community. And we need to sort of stand by our mission and our values around improving health, and just deliver on our mission to do what we can to get to the communities most in need, and particularly the rural communities that we serve. And so I think we'll just underscore and continue to do the work that we've been doing, but also learning from the past and how best to do that with our partners.
Yeah. Representative Brawley, so what can people do? You said, it's all is not well. And so what does the community need to do to make sure that we are taken care of? I mean, we elect officials, we need the government, the state, local, national government to fund things so that we as a community can be taken care of. And if it's not, you say our hands are not tied. So what can we do?
Well, of course, you can reach out to your own elected official. But keep in mind that the governor works for everybody. He is the governor of the entire state. So we can reach out to the governor. I would encourage people to do that. I've seen that to be very effective by small groups of people. And I think we in our community have to get comfortable with the notion that we can't just take a hands-off approach. We can't just say, well, that's just the way it is, because it doesn't have to be that way. We have to actually speak up and speak out, use every opportunity that we can. We have all kinds of vehicles that we can mobilize to make change. And we do that on some occasions, but we have to the church is not the only thing in our communities that we can rely upon. We have all kinds of social organizations who have a real strong focus on community health. And we need to engage them in their membership and let them know what's happening and how they can affect change. And I'll give you, for example, when we are debating particular pieces of legislation and those bills go to committee and a hearing is scheduled, the people that need to show up shouldn't be the people that don't believe in science. We need some people who actually believe in science to make themselves available and to be at those hearings to speak out. People don't think that makes a difference, but it does. Calling, writing, and being present makes a difference when legislation is being drafted and when legislation is being debated and when bills are being passed. So that, I hate to make everything political, but what in life isn't? Everything is regulated from womb to tomb. And so we have to accept the fact that the politics does interfere sometimes with our good health. And I think in South Carolina, because some of the political stances that were taken in our state, it interfered with the good health that could have been delivered much quicker if we would have gotten out of the way at the legislative level. I don't think that, some people have changed their minds about that, but unfortunately, there's still a mindset because we're still passing bills that would basically curtail the ability of employers even to require COVID vaccines, even when they're dealing with vulnerable populations. It's to their advantage to have their folks vaccinated if they're dealing with people who have comorbidities. But we have a General Assembly whose majority position is, this is your right. You have a right to make me sick and everybody else sick. So there are things that we must do as a community to raise our voices in a cohesive ability that we have through our organizations, not just the church, to be vocal at that state house so that we can actually get things done. And I know, I'm gonna be honest with you, there are many barriers to prevent that. Our people are working. They can't just take off and come up there and just sit vigil with people that they've elected. But I'm telling you, it's gonna take that in some instances to get what we need. Because it's not a question of the money. We have more money than we have ever had in South Carolina. We have more money. We can do so much good if we were willing to change our mindset so that that money reaches the places where it's needed the most.
Where is the money going now?
Well, there's a big issue of let's put it in as many highways as possible, as many interstates as possible. And I know the importance of safe roads, but when you ride through my community, the potholes alone are dangerous. We've got some roads that are impassable when it rains, that people actually live on. So we have to, as we allocate these millions and millions and sometimes billions of dollars, much of which has come to us through the federal government, on through a Congress that didn't even vote for it. And now when it gets to South Carolina, where you are controlled by the opposite party, and they're pushing in a different direction than we are because their priorities are much different. So while I support improving I-26 and doing as much as we can, I also want Bluff Road fixed, and I want the people who live in rural communities who've been eating dust for generations because their roads are not paved. I want them to have those, and believe that they have asthma and all kinds of other issues because of it. So we just have to, as a community of people, be willing to raise our voices and get a little bit uncomfortable doing so, because that's the squeaky wheel gets the that phrase is very much apropos to politics.
Yeah. Before we wrap up, we've got 10 minutes, and I'd like for each of you ladies to give a closing statement. I want to go back to you, Dr. Bell, because Representative Brawley made such a great point about funding. And my concern is, all right, if we can't, the funding is shaky at best for this thing, how do we get funding for the next thing? And there will be a next thing, and perhaps the next thing has already come in the form of monkeypox. I know this is a coronavirus conversation, but I would like for you to explain what monkeypox is, where it came from, the symptoms, and how this affects everything else that we're dealing with now.
Yes, well, monkeypox is caused by a virus. It's actually in the same family as the virus that causes the chickenpox. It's in the same family as the virus that caused smallpox, which we were able to eradicate. And monkeypox typically occurs in some countries in Africa and Central or South America. It can be an endemic disease in some of those areas. There's sporadic cases at a low level. There's a lot of attention being paid to this now, though, because there have been cases identified outside of those typical endemic areas, cases identified in people who had not traveled to areas where the disease is endemic. So somehow there's been some introduction of the virus that causes monkeypox in some communities internationally. Most of the cases were first recognized in the United Kingdom, but this is being seen in other countries. And so what monkeypox does is, if anyone were to go on the internet and look for images, is really striking, disfiguring lesions that are, they look like the chickenpox, but much larger, fluid-filled vesicles that can cover your body. If you see some of the more striking images, it can be associated with some complications. So unfortunately, really because we're all interconnected communities globally, that just through an airline flight, you can be on a plane with somebody and 24 hours later, that virus can be somewhere where it doesn't typically live. So we're monitoring for these cases of monkeypox. To my knowledge, only one case has been identified in the United States so far in Massachusetts. Now, we need to monitor this all the time to make certain that things don't change. But there is a system in place through the Centers for Disease Control and Prevention that notifies individuals who may have been in close proximity to someone that is identified on a flight that has monkeypox. So I won't go into the details, but there's a public health infrastructure that allows us to conduct surveillance for emerging threats worldwide. So if someone is on a plane and is identified, the CDC will notify jurisdictions that you may have people that live in your area who may have been in contact. The one thing that I want to our communities to be aware of, though, is this is not something to panic about. Monkeypox is usually spread from person to person by close contact with the actual lesions, those fluid-filled vesicles that you directly contact. So However, when a person is actively infected, there is a small chance that they can spread this by the respiratory route, just like the chickenpox can be spread by the respiratory route. So, I'm not sure how much detail you want, but if you see the striking images of what is caused, what the virus that causes monkeypox does, it begs the question, if that would happen to you, would you wear a mask now? So it is not an invisible disease, the striking disfiguration. But what COVID did to people was often invisible, right? You couldn't see visible lesions, you couldn't see this disfiguration. And people had to trust that the use of a mask can still prevent these severe hospitalizations. There are still many severe consequences, many deaths from COVID. So there are some comparisons that we can make there. We do not see this as something that will become a pandemic because it is spread more likely by that close personal and direct contact. But this is absolutely something that we need to monitor for. We know that people, they stopped offering the smallpox vaccine in this country, I believe, in the mid-1970s. So people who are younger than in their 50s have not been vaccinated against smallpox, which offers some protection against monkeypox. We also want to make sure that people are up to date on all their vaccines, like the chickenpox vaccine, because a case of chickenpox could make you wonder, is this a case of monkeypox? So to the extent that we can prevent these other diseases will help reduce any alarm. So if the next case of chickenpox comes up and there's all this national attention being paid to monkeypox, we don't want people to panic about things that are common and things that are uncommon. So this is certainly something that we need to monitor for. And we hope that if it comes to a case in a community, that people will follow the evidence-based guidance on how we can prevent this illness.
When do you know you have it? Do the lesions appear first?
Yes, there may be some sort of a what we call a prodrome, like sort of symptoms that occur before the rash breaks out. And there can be atypical presentations. So in other words, the rash may not cover your entire body. We're seeing that there is actually sexual transmission. So in that setting, you might see only those involved areas. So we want people to be aware of a history of travel to an endemic area, a history of contact with someone who's traveled. And if you have that history or you have suspicious lesions and they've been preceded by, achiness, feverishness, something like that, that would be something to see your healthcare provider about, certainly.
Last question about monkeypox, Dr. Bell. I did read last week that there were a few people that were thought to have it in South Carolina. What's the update on that?
Well, no, we have monitored contacts who have been on an airline with a case. And again, you have to be, it's not the entire plane. If you've been in the first few rows ahead of or behind, that's what we're talking about, close contact. And we have monitored individuals for things like monkeypox, things for avian influenza, and those individuals have been ruled out. We make sure that if you're a close contact, pay attention to the possibility of any symptoms, and if you get outside the incubation period with no symptoms, they're fine.
All right. Thank you, Dr. Bell, was just giving us a quick monkeypox update. Yet another thing. Listen, we've been talking about the pandemic, the coronavirus pandemic, and what to expect next. Please, ladies, give your closing statements about what is next and how should we move forward with the coronavirus. Ms. Jenkins, can you start, please?
Yeah, I think what this, and I really appreciate what Representative Brawley said about community engagement and community voice. And I think we can't forget what we learned over these last 2 years about the lack of access or the root causes that created the conditions for African Americans around the pandemic and the high mortality rates and infection rates in our communities, around what we needed to do from a preventative perspective to not, so that we didn't have those disproportionate outcomes from the pandemic. The fact that people didn't have access to broadband, the infrastructure didn't exist. I think we need to learn from that. And I think about health literacy as we were talking through all of this, ensuring that people have the right information in the way that they can receive it and hear it. I think we still have a lot of work to do around that to make sure that our community the prevention is critical for our community. So we don't have the conditions that exacerbated the COVID-19 virus in our community. And I just, for me, it just speaks to the fact that we have so much work to do in that area. We've done a lot of great work. We have quite a bit more work that we need to do, and we can't not highlight the importance of preventative behaviors, preventative opportunities for people as they're managing and navigating their own health. And so that's where I would like to end, is that we should be having conversations around that. So when the next thing does hit, we're better prepared for that as a community, and as an individual community, we're healthier and we'll be able to manage it better with our healthier outcomes.
Yeah, thank you. Angela Jenkins, VP of Accountable Communities at Prisma Health. Wendy Brawley, District 70 Representative, Richland and Sumter Counties. Your closing statement, please.
Well, I would echo a lot of what was just said by Angela, because I really throw a lot back into the power of communities to care for themselves. I think one thing that we saw in my community with COVID is that people became, I guess, got more empowered and more in charge of their health. They looked at their other illnesses and, sometimes chronic illnesses that they've suffered with for years, and they started to kind of appreciate the toll that those chronic illnesses have had on their bodies and how vulnerable those illnesses made them to COVID. And I think that if there was any kind of positive thing that came from COVID, it was probably that, because we see now more and more people, and at least I am seeing that in my community, having a greater interest in how they can stay healthy. How do you preserve your health longer? And if we can get more people to do that, we will probably lessen the number of people who have an onset of diabetes or high blood pressure or the kinds of chronic illnesses that have plagued our community. Just because grandma had high blood pressure doesn't necessarily mean you're going to die of a heart attack. If you take certain precautionary measures and you start doing that early, and not just think that skipping your medication is an option. So I do think that in my close, if I could say that we have done a great deal of work toward empowering people to appreciate their health. I think that this particular illness, COVID, has highlighted that and made people really understand that it's all connected. It is all connected: mind, body, and spirit. And we are working on all three in our community, because it has had a mental and emotional devastating impact in our community. And emotional well-being is just as important as physical well-being.
Thank you, Representative Brawley. And Dr. Bell.
Well, I also agree with my co-panelists. We have learned so much and we improved a great deal. And for future planning, we need to use what we've learned from this disaster to make communities in the future that are more vulnerable, more resilient. And we've learned that maybe in the past we had somewhat compartmentalized approaches, but it's not just the public health department's responsibility to improve the public health. We certainly it's not just the healthcare system's responsibility to care for those who are ill. All of these collaborations, all these partnerships that really grew during the pandemic really did improve. And we did receive assistance from our elected officials. And it worked. This community outreach, what is so encouraging when we talk so much about the disparities for COVID in communities of color, especially a lot of conversations early on about vaccine hesitancy, when in fact African Americans are now about equally covered as they are for other populations. And in fact, our African American children have a slightly higher vaccination coverage than do other children. And so these efforts to work with communities, trusted members in the communities, specifically to talk with communities of color, has been very successful. Now, the issue is, even though the coverage may be relatively equal across our populations now, in the state as a whole, we still have a relatively low vaccination coverage as compared to other states. So there is still some ideas that are barriers to our continued safety, our continued ability to control COVID's impact on us. But we have learned a lot, and we are, even at this time, making plans for the next pandemic of anything, whether it be a respiratory virus. You've asked about monkeypox. And so we need to continue to learn from what we've been through to continue to improve in the future, and we need to continue to maintain these partnerships. Things like unexpectedly how the faith community showed up to be the healthcare sources in communities, standing up testing sites, vaccination sites in non-traditional settings. So much opened up the community, and we need to be able to do that for the future. So we should be encouraged. We should also continue to be cautious and not take for granted that there is still somewhat of a threat. We don't want people to live in fear. I just want to say that Representative Brawley made an excellent point about the impact of the COVID pandemic, not just from the physical perspective, but from the mental perspective. And so we now must live with other fallouts from the pandemic in terms of how it has affected the mental health. There are many, many children who have been orphaned by the loss of parents, loss of breadwinners. And so there are many other consequences, long COVID, that we still must now address. And so I really appreciate bringing up, this is another public health crisis, is the need to be more aware of and provide services for those who suffer from mental illnesses, anxiety, depression as a fallout from COVID and other things. So we should be encouraged, however.
Yeah, you'll be glad to hear that that was the panel right before this one, the mental health issues, and if people should get it and how they can get it. And that was a great panel also. Dr. Linda Bell, epidemiologist for the state of South Carolina, Angela Jenkins, VP of Accountable Communities at Prisma Health, and Representative Wendy Brawley, representing District 70, Richland and Sumter counties in South Carolina. Ladies, thank you so much for sharing your time and your expertise. We appreciate you today from the South Carolina Legislative Black Caucus. Thank you. Thank you also for joining us for the Minority Health Summit, the 2022 Minority Health Summit from the South Carolina Legislative Black Caucus. Please continue to post and share this important conversation out so we can get the message to the masses. Coming up, a message from all of our sponsors, how you can connect with many other events from the South Carolina Legislative Black Caucus. But first, a closing message from Chair Representative Patricia Hennigan. I'm Trey Taylor. Thank you so much for joining us.
Hello again. Wasn't that information informative and much needed? We heard updates about COVID, learned about mental health, the importance of therapy in minority communities, and ways how we can combat health disparities. The Minority Health Summit will be uploaded to the South Carolina Legislative Black Caucus YouTube and Facebook for anyone to revisit. I thank you all for participating, and remember that your South Carolina Legislative Black Caucus is always here to serve you, and our doors are always open. Thank you for joining us.
No one takes care of families like Prisma Health. As South Carolina's largest health system, we have nearly 600 primary care doctors across the Midlands and upstate, so you can choose the one who's right for you. With a more personalized approach, more locations, and more convenience, including 24/7 virtual urgent care and online or in-person visits with your primary care doctor, we're doing even more to help you be your healthiest you. Prisma Health, the primary care experts.
Hey, South Carolina, you can make a choice for your Medicaid health plan. Choose Healthy Blue. With Healthy Blue, your whole family is covered for free or low-cost checkups and prescriptions, plus eye exams and glasses for kids and adults. Get all this and more from a plan backed by the Cross and Shield. The choice is easy. Get Healthy Blue now at choosehealthyblue.com/SC and get more from Medicaid.
For generations, Prisma Health has been taking care of South Carolina women throughout every stage of life, from adolescence to motherhood, through menopause and beyond. We provide all the services women need, including midwives and fertility experts. With more OBGYN specialists, more convenient locations, and more personalized care, we're doing even more to help you be your healthiest you. Prisma Health, the women's health experts.
Right now, we're tackling some of the hardest challenges of our time and finding answers to the questions that impact every community. In the biopharmaceutical industry, developing life-saving treatments and cures, working to help those in underserved communities, and supporting patients in need are all just a part of our everyday life, and we need your help. We're working to provide better access to our industry and to make more opportunities available than ever before. We're offering scholarships to make education accessible. We're putting more resources into our communities and providing support and mentorship to those who need it. If you're looking for a career in medicine, business, or marketing, then you have an opportunity to create change and save lives. We're fighting to drive research and innovation forward while paving the way for progress. And we know this can only be achieved when we fully embrace diversity, when we make it part of our DNA.
Prisma Health keeps South Carolina hearts beating strong. As the largest cardiovascular provider in the state and home to the only freestanding heart hospital dedicated to the prevention, diagnosis, and treatment of heart disease, we provide the heart care you need. With more innovative treatments like LVAD, more specialists, and more locations closer to you, we're doing even more to help you be your healthiest you. Prisma Health, the heart and vascular experts.
Thank you for joining us for the South Carolina Legislative Black Caucus and Prisma Health Minority Health Summit. Continue to tag, post, and share this informative session. And for more information about the Minority Health Summit or the South Carolina Legislative Black Caucus, contact Devin Owens at dowens.sclbc@gmail.com. Please like and follow the South Carolina Legislative Black Caucus on Facebook, Instagram, and Twitter, and subscribe to the YouTube channel and be the first to know about upcoming events, conferences, and what's going on in the State House. On behalf of Madam Chair Patricia Hennigan, the entire SCLBC, and each sponsor, including Prisma Health, Healthy Blue, and Pharma, thank you again. God bless. And remember, Black health, women's health, children's health, all health matters to the South Carolina Legislative Black Caucus.